The 8-year-old boy had been screaming for 47 minutes straight when the hospital administrator finally snapped and ordered security to physically remove him from the hallway. The child couldn't hear the order. He couldn't hear anything, not the nurses rushing past, not the PA system crackling overhead, not the orderly's heavy footsteps approaching from behind. What he could see was a world of strangers moving around him like he was furniture, and somewhere down that corridor, his father was dying. Or at least, that's what every terrified synapse in his body was telling him. Then a woman in scrubs knelt down directly in front of him, and her hands began to move. The screaming stopped instantly. Every person in that hallway froze. Before we go any further, if stories like this one hit you somewhere real, somewhere you weren't expecting, hit that subscribe button right now and turn on your notifications. Every week I bring you stories of ordinary people doing extraordinary things in places nobody's watching. Drop a like on this video and tell me in the comments, what city, what country are you watching from right now? I want to see how far this story travels. Now let's go back to that hallway, because what happened next changed everything. Harwick Naval Medical Center sat on the edge of Caldwell Bay, Virginia, close enough to the water that on certain mornings the salt fog rolled through the parking structure and made the whole building smell like the ocean. It was not a glamorous hospital. The corridors were wide and fluorescent lit and perpetually understaffed, the kind of place where the vending machines on the third floor had been broken for 6 months and nobody had filed the repair order twice. The patients were mostly active-duty military and their families, people accustomed to making do, to waiting, to not complaining too loudly about the gaps in a system that was supposed to serve them. Megan Hart had worked the fourth-floor medical surgical unit for 3 years. She was 36, with close-cropped auburn hair going silver at the temples, and a way of moving through a busy hallway that made other people instinctively step aside without quite knowing why. She was not the tallest woman in the unit, not the loudest, not the one who socialized at the nurses' station or remembered everyone's birthdays. She was the one who showed up 12 minutes early to every shift, who read the incoming patient files before the briefing started, who had a habit of going very still when something in a room didn't feel right. She had been called a lot of things in 3 years at Harwick. Efficient, competent, occasionally difficult, never warm. She had also been called, on more than one occasion by Dr. Rachel Mercer, just a nurse, which was the kind of phrase that had a way of settling into the walls of a place and staying there. The morning Ethan Cole arrived, Megan was finishing her intake assessment on a post-op patient in room 412 when she heard the boy before she saw him. Not because he was loud, though he was, but because the specific pitch of that distress, the way it didn't modulate the way a child's cry usually did, registered in some older part of her brain as something she needed to pay attention to. She found him in the hallway outside the family consultation room on the 3rd floor, a small boy in a gray hoodie with the name Cole, stenciled in black marker on the inside collar, the kind of labeling military families did automatically, a habit from deployments and base housing where things got mixed up and lost. He was rocking slightly, both hands pressed flat against the sides of his head, and the sound coming out of him was not quite crying and not quite screaming, but something in between that had cleared a 20-foot radius in both directions. 2 nurses stood near the station watching him with the particular helplessness of people who had tried everything they knew and run out of ideas. A security officer named Branson was approaching from the far end of the corridor with the resigned expression of someone about to do something unpleasant, and standing in the doorway of the consultation room with his arms crossed was Grant Holloway. Holloway was the hospital's administrative director, which meant he controlled scheduling, budget allocation, staffing ratios, and the general disposition of Harwick Naval Medical Center's non-clinical operations. He was 51, heavy-set in the way of a man who had once been athletic and stopped suddenly, with silver hair and the kind of permanent slight frown that people who had worked with him long enough no longer noticed. He wore his authority the way some men wore expensive watches, visibly, and with the expectation that you would notice it. "Branson," he said, not raising his voice, "remove the child from this floor." Megan was already moving. She crossed the distance before Branson reached the boy, and she didn't run. Running in a hospital corridor attracted attention and created panic. But she moved with a directness and economy that made it absolutely clear she had a destination and intended to reach it. She stepped in front of Branson without acknowledging him, lowered herself to one knee on the linoleum, and put herself directly in Ethan Cole's line of sight. The boy's eyes snapped to her face. He was 8 years old, brown-eyed, terrified in the way that children only get when the world has gone completely off script and nobody has explained what's happening. He had his father's jaw, she would learn that later, and his mother's hands, small and expressive even when they were pressed against his head. Megan waited one beat for him to focus on her. Then her hands moved. 3 words. Clean, precise, unambiguous American Sign Language. I see you. Ethan's cry cut off mid-breath. The hallway went quiet in the way hallways only go quiet when something genuinely unexpected happens. Not the absence of sound, but the presence of stillness, everyone holding what they were doing because something had shifted. Megan kept her eyes on Ethan's face and signed again, slower. You are safe. The boy stared at her hands for a long moment, like a person who has been lost in a foreign country and has just heard someone speak their language for the first time in days. Then something in his face cracked open, and he began to cry. Real crying this time, not the desperate animal sound from before, but the kind that comes with relief. He signed back at her, small frantic movements, and Megan read them without expression change, just tracking, processing, responding. She signed, "Tell me." He told her. His hands moved fast and imprecise the way children's hands do when they're upset, skipping letters, borrowing gestures, making it up as he went. But she followed every word. His father was in there. He had heard, felt, she corrected mentally, the vibration. Something bad happened the night before. Nobody would tell him anything. Nobody here knew how to tell him anything. He had been sitting in the same chair for 2 days, and the only information he had received was people's faces, and everyone's face looked scared. Megan took a slow breath and signed back. Your father is being taken care of. You did nothing wrong. You are not in trouble. Ethan looked at her for a long moment. Then he wiped his face with the back of his hand. Miss Hart. She stood. Holloway was 3 feet behind her, and he had not moved from the doorway, but his voice had the particular edge of a man who had just been publicly ignored and was cataloging it. Can I ask what exactly you're doing on the 3rd floor? I heard the child, Megan said. You're assigned to 4. I heard the child, she said again, in exactly the same tone, which was not aggressive and not apologetic and somehow more irritating than either. Holloway looked at Ethan, who had stopped crying and was now watching Megan with the focused attention of someone who was not going to let her out of his field of vision. Where are his parents? His father is your patient in 318, Lieutenant Marcus Cole, Navy. His mother is deployed. He's been here since Tuesday with a family liaison who apparently does not sign. She paused. Neither does anyone else on this floor. Holloway's frown deepened incrementally. That's a resource allocation issue. It's on the administrative schedule for... He's been here 3 days. Miss Hart. His voice dropped into the register he used when he wanted to be clearly understood. You are on this floor without authorization. You have interrupted a hospital security procedure, and you are now apparently representing yourself as an interpreter without any documented credentials to do so at this facility. I'd like you to return to your assigned unit. Megan looked at him for a moment. She had a way of looking at people when she disagreed with them that did not involve arguing. It involved a kind of flat, patient regard that some people found more unsettling than anger. I'll go back to 4, she said, after I talk to whoever is managing the Cole case about getting an interpreter in here today. That is not your department. No, she agreed. But it's my shift, and he's a patient in this building, and the standard of care in this facility, Holloway said, is my department. Thank you, Miss Hart. He turned and walked back into the consultation room. Branson, who had been standing 6 feet away through all of this, with the studied neutrality of a man who had learned long ago not to have opinions in administrative disputes, quietly redirected himself toward the nurse's station. Megan crouched back down to Ethan's level. She signed, I have to go back to my floor, but I'm going to talk to someone about getting you a person who knows how to speak to you, okay? Ethan signed back, slower this time. Are you coming back? She didn't answer that. She signed, What's your name? He signed it. Ethan. She showed him the hand shape. I'm Megan. He copied her name sign carefully, the way kids do when they're paying full attention, and something in his expression settled the way a frightened animal settles when it decides, provisionally, to trust. She stood, checked her watch, and went back to the elevator. She had 7 patients on 4 and a med pass that started in 20 minutes. The 3rd floor had a deaf child sitting outside his father's room with no interpreter, no information, and no plan. She had been working at Harwick for 3 years. She knew exactly how long the administrative scheduling process took. She also knew that Marcus Cole's chart, which she had glanced at through the consultation room window, had a flag on it that nobody had explained to her yet. A small red notation in the upper right corner that indicated a consult request from someone outside the standard medical team. She filed that information in the back of her mind and took the stairs. By 11 that morning, 3 things had happened that collectively made Megan's day considerably more complicated. The first was that she had submitted a formal request through the nursing supervisor's office for an ASL certified interpreter for Ethan Cole, which the supervisor had received, acknowledged, and forwarded to administration, where it would sit in Holloway's inbox until he decided what to do with it. The second was that Dr. Rachel Mercer had stopped by the 4th floor station to inform Megan, with the particular brand of precision that Mercer used when she wanted to establish hierarchy without technically being rude, that her unauthorized presence on the 3rd floor had been noted, and that in the future any cross-floor patient interactions should be cleared through the attending of record. The third was that Marcus Cole's tremor had started. She found out about the tremor the way she found out about most things at Harwick, indirectly, through the machinery of the place, through a comment in the elevator from a transport tech, through a notation in the system that appeared when she was cross-referencing a medication order for one of her own patients. The chart note said, Lieutenant Cole, left-hand tremor onset 0930, attributed to anxiety and stress response. No change in treatment plan. Megan read that sentence twice. She read it the way she had learned to read certain things, not for what they said, but for what they didn't say, for the space between the words where the actual information lived. She knew something about tremors. She knew something about the particular way a left-hand tremor presented in a patient with a history of cranial trauma, and she knew it because she had spent 4 years working in environments where you got very good very quickly at distinguishing between anxiety and something that was going to kill someone, because in those environments the cost of getting it wrong was paid in a specific and irreversible way. She finished her med pass, handed off 2 pending assessments to the float nurse, and walked back to the elevator. The 3rd floor was quieter than it had been that morning. Ethan was no longer in the hallway. Someone had moved him to a family waiting area around the corner, a marginally better situation involving a chair with cushions and a television mounted too high on the wall. He was not watching the television. He was watching the hallway entrance with the vigilance of a child who had learned that important things happened in hallways. He saw her, and his expression did something complicated, relief and wariness at the same time, the face of someone who has had their expectations disappointed enough times that they don't fully trust good surprises. She signed to him. "Has anyone brought you food today?" He shook his head. She made a note of that and kept moving toward 318. Marcus Cole was 41, black, built like a man who had spent 2 decades in the Navy doing physical things, and currently lying in a hospital bed looking approximately a decade older than his file photo. He had the particular flatness of someone on the descending side of bad news, the kind of stillness that wasn't rest. His left hand, resting on the blanket, had a fine tremor that was visible from the doorway. The attending on his case was Dr. Philip Strand, who was not present. The nurse at the bedside was a second-year named Kowalski, who looked up when Megan came in with the expression of someone hoping to be rescued from an ambiguous situation. "Mercer cleared a consult from someone on 4, Kowalski said, immediately uncertain. "Or did she?" "I'm here as a courtesy," Megan said, which was both completely true and entirely misleading. She looked at Marcus's hand. "How long has that been going on?" "Since around 9:30. Dr. Strand assessed it as stress response." Marcus was watching her. He had the eyes of someone who was listening to everything, parsing everything, who had spent a long time in rooms where the official version of events and the actual version of events were 2 different things. "You were on the floor this morning," he said. "With my son." "Yes." "You sign." "Yes." He studied her for a moment in the way that people with good threat assessment instincts study things they haven't categorized yet. "Where did you learn?" "Worked with a team that had a deaf combat medic for 2 years," she said. "You either learn or you become a liability." Something shifted in his expression at that. Not recognition exactly, more like the activation of a dormant alertness. The way a person looks when a sound from a long distance away matches something stored in memory. "What kind of team?" he said. She didn't answer that. She moved to the side of the bed and looked at his hand without touching it. The tremor had the specific character of something neurological rather than emotional. It was too regular, too involuntary, too disconnected from the rest of his body's state. His face was controlled. His hand was not. "Did anyone pull imaging from your last deployment?" she asked. "They pulled my records from Bethesda." "Did they look at the 2019 scan specifically?" He went still. "How do you know about the 2019 scan?" "Your chart has a flag I'm not supposed to be able to read," she said. "And the consult request attached to it came from a vascular surgeon in D.C. whose specialty is cranial fragment cases in active duty personnel." She looked at him directly. "So I'm asking if they've looked at the 2019 scan." Marcus Cole stared at her for a long moment. Outside the window, the fog had burned off, and the bay was flat and gray and going silver in the late morning light. "No," he said quietly. "They haven't." She straightened up. She pulled out her phone, opened the hospital system, and started navigating to the imaging archive. Kowalski watched this with the expression of someone who understood they were witnessing either excellent clinical judgment or a career-ending mistake and couldn't quite tell which. The 2019 scan took 40 seconds to load. Megan looked at it. She looked at it for a long time, longer than someone who was uncertain would look, and then she put the phone in her pocket and turned toward the door. "I'm going to find Dr. Strand," she said. "What did you see?" Marcus said. She paused in the doorway. She considered how to answer that. She thought about the particular ethical geometry of what she was about to do, the difference between what she was allowed to say and what she believed he deserved to know. "Your hand is going to keep doing that," she said, "and then it's going to get worse. I need to get to Strand before the scheduled medication goes in at 12. She was out the door before he could respond. Dr. Philip Strand was not on the third floor. He was not on the second floor, or in the physician's lounge, or in the radiology suite where his schedule said he had a noon consult. His pager, when Megan asked the station coordinator to try it, went unanswered for 11 minutes. His cell phone went to voicemail. The on-call supervisor said he was technically reachable but had stepped out for a personal matter and was expected back by 12:15. The scheduled medication was a sedative, a standard pre-procedure dose intended to manage Marcus's anxiety before an afternoon imaging appointment. The order was written. The pharmacy had already sent it up. Kowalski had it on the cart. Megan stood at the nurse's station and did the arithmetic. She knew what was in that 2019 scan. She had seen cranial fragment cases in environments where the nearest imaging suite was a helicopter ride away, where the margin between observation and intervention was measured in minutes, and the cost of miscalculation was not a lawsuit, but a body bag. The fragment she had seen in Marcus's scan was old, well encapsulated, stable-looking to someone who wasn't looking for what she was looking for. But the tremor told a different story. Tremors like that, with that regularity, in a patient with that history, meant the fragment was no longer stable. And a patient with an unstable cranial fragment who received a sedative that dropped his blood pressure was a patient whose fragment was going to move. She thought about the last time she had made a call like this. She thought about it for approximately 3 seconds, which was about 3 seconds longer than she'd had in the original situation, and then she turned away from the station and walked back toward 318. Dr. Rachel Mercer was coming out of the room next door. Mercer was 47, sharp-featured, with the kind of professional armor that takes years to build and looks like confidence from a distance, and something colder up close. She was one of the senior attending physicians on the medical surgical floor and had a reputation for precision that was entirely deserved, and a manner that was, depending on your tolerance for hierarchy, either appropriately efficient or systematically dismissive. She saw Megan and stopped. "Miss Hart." Her voice had the quality of someone who had been preparing a sentence. "I was informed you were on this floor again. I need Strand's imaging review pulled before the 12 o'clock med. Dr. Strand's patient management is not your concern. The sedative will drop his pressure. With a shifting fragment, that's—" "Excuse me." Mercer's voice got quieter, which was the way it got when she was most certain she was right. "Are you telling me how to manage a patient you have no clinical authority over, based on an imaging review you had no authorization to access?" "I'm telling you what I saw." "You're a nurse," Mercer said. "Stay in your lane." The phrase landed in the hallway the way it always landed, not quite loudly enough to be something you could formally object to, not quite quietly enough to be something you could pretend you hadn't heard. Megan looked at her. She had heard variations of that sentence for 3 years. She had heard it in boardrooms and briefing rooms and hospital corridors, and once, memorably, in a field hospital tent in a place she was not supposed to have been, delivered by a man who had needed her to ignore it in order to survive the next 6 minutes. She had developed a particular relationship with that sentence. She did not argue with it. She did not perform offense at it. She noted it, filed it, and continued with what she was doing. "I'm going to ask you," she said, "to look at the 2019 scan before the medication goes in. That's all I'm asking. And if I decline, then I'll document that I made the request." Mercer stared at her. "You'll document?" "Yes." "And then?" "And then I'll go back to my floor," Megan said. "And at 12:15 someone will push the sedative, and Marcus Cole's blood pressure will drop, and if I'm wrong about the fragment, everything will be fine." She let that sentence end there. She didn't finish it. She didn't need to. Mercer held her gaze for a long moment. There was something calculating in it, the look of someone running options. "Show me the scan," she said finally. They were standing outside 318, Megan pulling the image up on her phone, when Holloway appeared at the end of the corridor. He had a particular walk when he was displeased, measured, deliberate, the walk of a man who considered his time valuable and wanted you to know what you were costing him. He covered the distance from the elevator to where they were standing in about 15 seconds and stopped with his arms crossed in a way that was meant to convey authority, but mostly conveyed the position of someone who had prepared their argument in advance. "Miss Hart," he said, "I believe I was clear this morning." "You were," she said. "And yet." "And yet," she agreed. He looked at Mercer. "Rachel, is there a clinical reason for this nurse to be on my floor for the third time today?" Mercer looked at the image on Megan's phone. She looked at it for a long time, longer than Megan expected, long enough that something in the air shifted. "Philip hasn't reviewed the 2019 scan," Mercer said. It wasn't clear if she was answering Holloway or stating it for the record. "That's between Dr. Strand and his patient," Holloway said. "Miss Hart, I'm going to ask you one more time to return to your assigned floor. If you decline, I will be contacting nursing administration about a formal review of your conduct and your continued employment at this facility." Megan looked at him. She thought about Ethan in the waiting room with no food and a television mounted too high on the wall, watching the hallway entrance with that specific kind of vigilance. She thought about Marcus Cole's hand on the blanket, tremoring with the quiet persistence of a thing that was not going to stop on its own. She thought about a room she had entered 11 years ago, alone, with a device that was set to go off in 8 minutes, and the 19 men outside who didn't know yet whether she was going to walk back out. She thought about all of that in approximately 2 seconds. Then she looked at Mercer. "The fragment is in the left posterior fossa," she said. "If you look at the 2019 position versus the imaging from last week, it's moved 3 millimeters toward the vertebral artery. The tremor started 4 hours ago. The sedative is scheduled for," she checked her watch, "38 minutes. Mercer had stopped looking at Holloway. She was looking at the phone. "How do you know the position from last week?" "I pulled the current scan when I was in the room." "You don't have clearance to pull imaging on a patient who isn't yours." "No," Megan said. "I don't." The corridor was very quiet. Holloway was saying something. His voice had risen slightly, which was unusual for him, and he was using words like egregious and insubordination and immediate review. But Megan had stopped tracking the specific content and was watching Mercer's face instead, watching the precise moment when the thing Mercer was looking at on the phone stopped being an unauthorized intrusion and started being something she needed to think very carefully about. Mercer looked up. "I need to call Strand," she said. "Rachel," Holloway started. "I need to call Strand," Mercer said again, in the voice of someone who has made a decision and is no longer in a conversation. She walked away from both of them, already pulling out her phone. Holloway looked at Megan. His expression had the quality of someone who has been publicly stepped around and is filing the experience away with precise and detailed intent. "We're not done," he said. "I know," she said. He turned and walked back toward the elevator. Megan stayed where she was, outside the door to 318, and she could hear through the small gap in the doorway the sound of Marcus Cole talking to someone. A one-sided conversation, the kind people have when they're trying to reach someone by phone. His voice was low and controlled in the way of someone who has had extensive practice controlling their voice in situations where losing control would cost them something important. She pushed the door open. He was sitting up in the bed, phone pressed to his ear, and he looked at her when she came in with an expression that had changed since she'd left. Some layer of the careful blankness had receded, replaced by something more direct, more alert. He lowered the phone. "Who are you?" he said. Not aggressively, not the way people say it when they mean get out. The way people say it when they actually want to know the answer. Megan stood at the foot of his bed. His hand was still tremoring on the blanket. Outside, she could hear Mercer on the phone, could hear the clip of her voice, even through the closed door, could hear the cadence of someone delivering information with urgency. She thought about how to answer his question. She had answered it different ways over the years, in different rooms, with different amounts of information depending on what the situation required. She had learned, the way you learn things that cost something, that the answer you give in the moment before everything changes tends to be the one that matters. "I'm the nurse who's been on your floor 3 times today," she said, "because someone needed to be." Marcus looked at her. His eyes moved to her hands. Not the way people look at hands when they're gesturing, but the way people look at hands when they're reading them. The way someone who knows sign language looks at the hands of someone else who knows sign language, checking, categorizing, looking for the specific calluses and muscle memory that tell you how long and where and why. His expression changed. It changed the way expressions change when a memory arrives that you weren't expecting. Not gradually, not with warning, but in the sudden involuntary way of something surfacing from a long way down. He said, very quietly, "I've seen those hands before." Megan went still. "Virginia Beach," he said, 2013, EOD support. There was a... He stopped, swallowed. "They told us the specialist didn't make it." The room was very quiet. Marcus Cole's left hand lay on the blanket, tremoring with the steady, involuntary rhythm of something that was not going to wait for anyone to be ready. He looked at her face. He looked at her hands. And the expression that crossed his face then, the specific combination of recognition and disbelief and something older than either, was the expression of a man who had just understood that the woman standing at the foot of his bed was someone he had watched a door close behind 11 years ago and had spent 11 years assuming was dead. She didn't confirm it. She didn't deny it either, and in the particular grammar of people who have spent time in environments where information is a resource, the silence itself was an answer. Marcus Cole sat very still. His hand continued its tremor against the blanket, indifferent to the weight of the moment, indifferent to everything except whatever was happening in the tissue and vessels of his skull that had set it in motion. He looked at Megan with the expression of a man recalibrating a map he had been using for 11 years, and discovering that several of the landmarks were wrong. "Virginia Beach," he said again, quieter this time, like he was testing whether the word would hold its shape if he said it softly enough. "You went in alone." "Someone had to." "They said the blast—" "It wasn't the blast." She moved to the side of his bed and looked at his hand without touching it. "The blast was contained. The hearing wasn't." She said it the way people say things they have had a long time to make peace with. Not casually, not dramatically, just flatly, the way you state a fact that stopped hurting in the acute sense years ago, even though the shape of it never quite left. "I need you to listen to me right now, because we have about 30 minutes before someone pushes a medication that I do not want inside you." He shifted his attention immediately, the way trained people do, not fighting the gear change, just making it. "What did you see in the scan?" "A fragment that's moved since 2019. Posterior fossa. Left side, trending toward the vertebral artery. The tremor is not anxiety. It is your nervous system telling you something that the official treatment plan is not accounting for." Marcus was quiet for a moment. "How confident are you?" It was the right question, not "are you sure," not "could you be wrong," but a request for calibration, for an honest probability. The kind of question people asked when they actually wanted information rather than reassurance. "Confident enough to be standing in a room I'm not supposed to be in for the 3rd time today," she said. He looked at her for another moment. Then he nodded, once, the small, deliberate nod of someone who has made a decision. "What do you need?" "I need Mercer to delay the sedative until Strand has reviewed current imaging against 2019. I've already asked her. She's on the phone with Strand now." She paused. What I also need is for you to tell me if there's anyone in your chain of command who should know you're here. Something moved behind his eyes. Why? Because your chart has a consult flag from a vascular surgeon in DC who specializes in service member fragment cases. And that flag was placed before you were admitted, which means someone in your command knew this was a possibility before you came through the door. She kept her voice level. Which means someone has been tracking this. And I'd like to know who before this afternoon gets more complicated than it already is. Marcus Cole looked at the ceiling for a moment. He had the expression of a man deciding how much to trust something he wanted very badly to trust. It was a familiar expression to her. She had seen it in a lot of rooms, on a lot of faces, in the years before she'd ended up at Harwick and Scrubs, managing a med-surg floor and filing interpreter requests that disappeared into Holloway's inbox. "There's a number in my phone," he said. "Contact listed as Reyes, D. If it gets to that point..." The door opened. Mercer came back in without knocking, which in hospital terms meant she had stopped thinking about professional courtesy and started thinking about something else. Her face had the focused, slightly compressed quality of someone who has received information that has reorganized their priorities. Strand reviewed the current scan, she said. She was speaking to both of them, which was itself a departure from her usual mode. She pulled out her own phone, held it so Marcus could see the image on the screen. "He agrees the fragment position has changed." She looked at Megan. "He wants to know how you identified the shift from a bedside phone review." "I've seen this presentation before," Megan said. "In what context?" "A clinical context." Mercer looked at her with the expression of someone who has asked a question and received a non-answer and is filing the distinction away. "The sedative is being held. Strand is calling vascular for an emergency consult." She hesitated, and Mercer did not hesitate, as a rule, which made the half-second pause notable. "He also wants a repeat MRI with contrast before the afternoon." "When?" Megan asked. "Within the hour, ideally." Mercer looked at Marcus. "Lieutenant Cole, I want to be transparent with you. The imaging we reviewed this morning did not include the full historical comparison that..." She stopped, restarted. "We should have caught this earlier. That's on us." Marcus said nothing. He was watching Mercer with the patient, slightly flat attention of a man who had learned that apologies delivered in the middle of a crisis were a different category of thing than apologies delivered after. He would process this later, or he wouldn't, but right now he was somewhere inside the practical problem of what happened next. "How long is the MRI going to take?" he asked. "The scan itself is 40 minutes. The read, I want my son in the room before I go in." Mercer looked at him. "Lieutenant, he's been sitting in a waiting room for 3 days," Marcus said. "He thinks I'm dying. I want 10 minutes with him before they put me in a tube." Mercer glanced at Megan, which was not a thing Mercer typically did. Glancing at nurses for input was not in her usual operating procedure. But the situation had shifted enough that the usual map wasn't quite working. "I'll get him," Megan said. Ethan was where she'd left him, in the family waiting area around the corner, in the chair with the flat cushion. He had eaten something. There was a wrapper from a package of crackers on the seat beside him that hadn't been there before, which meant someone had thought to bring him food in the last hour, which was at least something. He was sitting with his knees pulled up and his arms wrapped around them, watching the entrance to the corridor with the steady vigilance of a child who has decided that the most useful thing he can do is not miss anything. He saw her and came off the chair fast, the crackers wrapper sliding to the floor, and signed before he had fully crossed the distance between them. "Is my dad okay?" She signed back. "He's okay. He needs a test. He wants to see you first." Ethan stared at her. His face was doing several things at once. The relief was right there at the surface, immediate and physical, but underneath it was the specific wariness of a kid who has been given good news in bad situations before and knows that good news can have conditions. "Really?" he signed. "Really? Come on." He came with her without hesitation, matching her pace through the corridor, and she watched him in her peripheral vision the way she had learned to watch people she was responsible for. Not intrusively, just tracking, the habit of someone who had spent years in environments where knowing the state of the people around you was not courtesy, but operational necessity. He walked close to her. Not holding her hand, he was 8 years old and he had some dignity, but close enough that she could feel the heat of him beside her. She brought him to 318 and stood in the doorway while he went in. What happened in the next 7 minutes was not something she watched in its entirety. She gave them the room. She stood in the corridor with her back against the wall and her eyes on the middle distance, and she let a Navy lieutenant and his deaf 8-year-old son have 7 minutes of privacy in a hospital room that smelled like antiseptic and recycled air because some things did not require a witness. What she did hear, because the door was not completely closed, and she was standing 4 feet away, the specific sound of a child's signed language, which was not silence, but the soft percussion of hands moving. The occasional small vocalization that people who are deaf from childhood sometimes make without being aware of it. And under that, Marcus Cole's voice, lower and rougher than it had been in the conversation with her, saying his son's name in a way that had nothing to do with his training or his rank or his carefully maintained composure. She looked at her hands. She had not looked at her own hands in a deliberate way in a long time. They were the hands of a woman who was 36 and had done a lot with them. There were 2 scars on the right one across the knuckle of the index finger, one at the base of the thumb, that were old enough to have gone white and smooth. There was a slight asymmetry in the way the fingers of the left hand lay at rest, the result of a fracture that had healed correctly, but not perfectly. She was thinking about what Marcus had said. They told us the specialist didn't make it. She had known, in an abstract way, that her official status in the aftermath of Virginia Beach was complicated. She had been medically separated. There had been paperwork. The nature of the paperwork and the specific way that her file had been handled afterward had involved people above her pay grade making decisions she had not been fully read into. She had not asked a lot of questions. She had been in a significant amount of pain, physically and in other ways, and asking questions had seemed like a project that could wait. And then years had passed, and the project had never moved back to the top of the list. She had not anticipated that one of the 19 men from that room would end up in a bed 20 feet away from where she was standing. She filed that thought away and turned her attention back to the immediate problem, which was that Holloway was going to come back, and when he did, the conversation was going to be different than the one they'd had this morning. He had warned her. She had not complied. Mercer had overridden the treatment plan, which Holloway would interpret, correctly, as Megan's intervention having produced a clinical outcome that contradicted his authority, and Holloway was not a man who received contradictions gracefully. She had about 2 hours before that conversation happened. Maybe 3, if the MRI took longer than expected. She needed to use them correctly. She pulled out her phone and looked at the contact Marcus had mentioned, Reyes D. She didn't have the number. It was in Marcus's phone, which was in Marcus's room, which she was giving him 7 minutes alone in. She thought about what she knew about the name. Reyes was not an unusual name. D. Reyes in a Navy context could be any number of things. The fragment consult flag, the DC vascular surgeon, the pre-admission notation that someone in command had known Marcus was coming, all of that suggested that Marcus Cole was not simply a patient who had walked in through the regular intake process. He was a patient someone was watching. Someone had been expecting this. The door to 318 opened. Ethan came out first, and his face was different. The vigilance was still there. It probably wasn't going anywhere for a while. But there was something underneath it now that had not been there before. Something that looked like ground. Something to stand on. He looked up at Megan and signed, "He's not dying." "No," she signed. "He's not. He needs the test." "Yes." "Will you stay?" She looked at him. He was asking with his hands and also with everything else. His whole face, his posture, the way he had angled his body slightly toward her like a plant toward the one window in a room. She was not supposed to be on this floor. She had 4 patients upstairs and a supervisor who was going to have questions, and an administrator who had made a promise about her employment that she did not think was an idle one. For a while she signed. It was not a lie. It was also not the whole truth, but it was what she had. The MRI was delayed by 40 minutes because the contrast unit on the imaging suite's primary machine had developed a calibration error sometime that morning, a fact that nobody had caught until the tech ran the pre-scan checks at 12:45. This was the kind of thing that happened at Harwick with sufficient regularity that it had its own informal name among the nursing staff, a Tuesday, regardless of what day it actually was, because the running joke was that at Harwick, every day had the energy of a Tuesday. The secondary machine was available but had a longer queue. Marcus went in at 1:17. Megan spent the time doing 2 things simultaneously, which was a skill she had developed in environments where the luxury of single tasking was not available. She managed her fourth-floor patients by phone and charting system, fielding questions from the float nurse she'd handed off to, reviewing labs, approving 2 routine orders that were within her scope, and generally performing the functions of a charge nurse who was technically on her floor even though she was not physically on her floor. This was not optimal, and she knew it, and she also knew that Kowalski was handling the third-floor solo during the imaging wait, and was 23 years old and had 18 months of experience, and so she stayed. She also made a call, not to Reyes D. She still didn't have that number, but to the nursing supervisor's office, specifically to leave a message for the day supervisor, Patrice Odom, who had been Megan's supervisor for 2 of her 3 years at Harwick, and who had the specific quality of a person who paid attention to the difference between the version of events that ended up in the official record and the version that actually happened. The message she left was brief and factual. She had identified a potential clinical concern in a third-floor patient. The attending had been notified. Imaging was in progress. She was maintaining coverage of her fourth-floor patients remotely, and she wanted it documented that she had communicated this proactively. She kept her voice level and professional and did not editorialize. She had learned that the time to editorialize was never, and that the documentary record was its own form of protection. At 1:53, Strand called Mercer. Megan was not in the room when this happened. She was at the third-floor nursing station, reviewing Kowalski's afternoon med schedule, and making small talk with a transport tech named Willis, who had the gift of making small talk that didn't require much reciprocation, which she appreciated. She knew the call had happened because Mercer came out of the consultation room with the specific body language of someone who has just received information that requires immediate action. Shoulders forward, pace changed, the phone already up for a second call before the first one was fully finished. Megan stood up. Mercer saw her and stopped. Something crossed her face, the particular complicated expression of a person who has spent a career in a specific kind of professional certainty and has just had a piece of that certainty adjusted. "The fragment has shifted," Mercer said. "Not by millimeters, significantly. Strand is calling vascular surgery now." She paused. "They're going to need to go in." Megan absorbed this. "How soon?" "Today, if vascular can clear an OR." Mercer looked at her in a way she had not looked at her before. Not the top-down assessment of a physician looking at a nurse, but something more horizontal, more uncertain, more like one person looking at another person whose capabilities they have just had to revise. "How did you know?" "The tremor presentation," Megan said, "and the 2019 scan. The encapsulation had started degrading along the inferior margin. It wasn't obvious if you weren't looking for it. Most people wouldn't have looked for it." "No." "How did you know to look for it?" Megan was quiet for a moment. "I've worked with fragment cases before." "In what capacity?" The question sat in the air between them. It was the second time Mercer had asked a version of it, and it was a fair question, and the answer was not one Megan was prepared to give in a hospital corridor while a vascular team was being assembled in an operating room 2 floors down. "A capacity that's not on my Harwick file," she said. Mercer stared at her. It was the stare of a woman who is very intelligent and does not like information gaps, and who is also, in this specific moment, too deep in an urgent clinical situation to pursue the gap as aggressively as she would like. "We need to tell his son," Mercer said finally. "I'll do it." "He's going to need... There should be a social worker, a family liaison." "I'll do it," Megan said again. "He needs someone who can actually talk to him." Mercer looked at her for another moment. Then she nodded, once, and walked toward the phone bank. Telling Ethan was the hardest thing Megan had done that day, which was a day that had already included several things she would have preferred not to do. She found him in the family waiting room, in the same chair, in what she was beginning to recognize as his specific version of waiting, contained, watchful, conserving energy. The posture of a child who had learned that waiting was a thing you could either do badly or do well, and who had decided, somewhere along the line, to do it well. She sat down next to him instead of crouching in front of him. Beside him felt less like a briefing and more like sitting beside someone, which she thought was probably what was needed. She signed, "I need to tell you something about your dad." He went very still, his eyes fixed on her hands with an intensity that made her aware of every movement she was about to make. She signed it plainly, because Ethan had not given her any indication that he wanted things softened, and she thought that softening it would be a kind of disrespect. The test found something in his head. Doctors need to do an operation today to take it out. It's serious. But the doctors are very good, and they found it in time. She watched him process it. He was 8 years old, and he had the processing speed of someone who had grown up reading faces and environments for information, who had become very good at rapid comprehension because the alternative was always being behind. His hands moved. In time because of you. She shook her head. Signed, in time because your dad came to the hospital. Ethan shook his head right back at her, with the particular decisiveness of a child who has decided he knows something. You made them look. She didn't argue with him. She signed, he's going to need the operation to be done before you can see him again. It will take a few hours. I'm going to stay here with you for part of that time. Part? Part, she confirmed. I have patients upstairs who need me too. He absorbed this. Then he signed, were you in the military? She looked at him. Why do you ask? My dad said. He paused. When I went in to see him, he said the nurse who's been here all day used to do what he does. He looked, he searched for the sign and then used a combination she hadn't seen before. An improvised gesture that she parsed as something like shaken or moved, the kind of invented sign that deaf kids create to fill gaps in their vocabulary. He looked like that. She sat with that for a moment. A long time ago, she signed. What did you do? I was a medical specialist. She chose her words carefully. I helped people who got hurt in dangerous places. Like my dad? Like your dad. Ethan looked at her hands again. He had the focused attention he'd had that morning in the corridor. That quality of reading her not just for the words but for everything else. The way people who communicate through visual language learn to read the space around the language, the hands and face and body together. He signed, do you miss it? She thought about that longer than she had intended to. Sometimes, she signed. But I do something important here too. He nodded slowly, as if this confirmed something he had already been working out. Then he signed, I'm going to be a doctor. She almost said something predictable, something encouraging and empty in the way adult responses to children's announcements of ambition tended to be empty. And then she didn't, because he wasn't asking for encouragement. He was stating something. There was a difference. Good, she signed. He seemed satisfied with that. Grant Holloway arrived at the third floor at 2:41. She had known he was coming the way you know certain things at work. Not because anyone told you, but because the rhythm of the day had a particular shape, and the shape of this day had been trending toward this conversation since approximately 9 that morning. She had used the intervening hours as well as she could. She had her documentation in order. She had her message to Patrice Odom time-stamped. She had a very clear recollection of every specific thing she had said, in what order and to whom, which was a habit so deeply ingrained that she sometimes did it without meaning to, narrating the record in real time, building the case before anyone had decided there was a case. He came with a woman named Brenda Farrell, who was from HR, which told Megan a number of things about how seriously Holloway was taking this, and how carefully he had been thinking about it while the rest of the floor was dealing with a man whose skull was being prepared for surgery. They found her at the nurse's station. Kowalski was not present. She had sent him on a supply run 10 minutes ago without exactly calculating that Holloway would arrive during the window this created, but also not without calculating it. Holloway's expression was composed in the specific way of someone who has decided that being composed is its own form of power. Miss Hart, he said, I'd like to speak with you in the conference room. I'll need 5 minutes, she said. Kowalski is bringing supplies and someone needs to be at the station. This can't wait. It can wait 5 minutes, she said pleasantly, or I can step away from an active floor and you can explain to the nursing supervisor why coverage lapsed. She paused. Your call. Farrell glanced at Holloway. He looked at Megan with the expression of someone who is recalculating the cost of a particular approach. 5 minutes, he said. She used 4 of them finishing what she was doing and the 5th walking to the conference room. The conference room was a small space off the main corridor, the kind of room that existed for exactly this kind of conversation. Not large enough to feel formal, not comfortable enough to feel safe, with a table that had too many chairs around it for a meeting of 3. Holloway sat across from her. Farrell sat to the side with a notepad in the way of someone whose function is documentation and who would prefer not to be noticed. Let me be direct, Holloway said. Please, Megan said. You were warned twice today about unauthorized presence on this floor. You were explicitly told that continued presence would constitute grounds for formal review. You continued. He folded his hands on the table. Regardless of any clinical developments this afternoon, the conduct issue stands independently. You challenged a physician's authority without clinical jurisdiction. You accessed patient records outside your assignment. You created a pattern of insubordination that, frankly, is not new. She waited to make sure he was done. He was. Lieutenant Cole is in surgery right now, she said. The fragment that Dr. Strand and the vascular team found, the one that required emergency intervention today, was identified because I reviewed imaging that I did not have authorization to review. I'm aware of that. She kept her voice even. I am also aware that if the sedative had been administered as scheduled, the blood pressure drop would have caused a shift that the surgical team now believes would have been unsurvivable within 2 to 4 hours. Holloway's expression did not change. He was good at that. The clinical outcome is a separate matter from... I'd like to raise a different matter, she said. Ethan Cole has been in this hospital for 3 days without access to an interpreter. He is the 8-year-old deaf son of an active-duty Navy officer. The communication access for medical patients standard, which this facility is bound by under the agreements governing its operating charter, requires that a qualified interpreter be available within 2 hours of patient admission when a family member requires one. Ethan Cole has been here 71 hours. The room was quiet. Farrell had stopped writing. That's a separate administrative matter, Holloway said. I submitted a request this morning, Megan said. I have the timestamp. I also have the date the family was admitted and the date the liaison officer's intake form noted that Ethan Cole is deaf. That's a 3-day gap. She paused. I'd like to know when the interpreter is being scheduled because I intend to document the request and the response. Holloway looked at her with the expression of someone who has gone into a conversation to accomplish one thing and has found the terrain has changed. Miss Hart, he said quietly, I want to be very clear about something. Whatever happened in that imaging suite this afternoon does not change the fact that you repeatedly violated protocol, disregarded direct administrative instruction, and disrupted the functioning of this floor. That review is moving forward. I understand, she said. You may want to consult with your union representative before... I'm not in the union, she said. A brief pause. Then you may want to consider your position carefully. She looked at him across the table. She had been in rooms where the person across from her had more power than she did. She had been in such rooms more times than she could count, in her previous life and in this one, and she had developed a specific internal stillness that she retreated to in those moments. Not detachment, not coldness, but something more like the particular focus of someone who has identified the actual problem and is not going to be distracted from it by the theater of the conversation. Mr. Holloway, she said, I'd like you to contact whoever oversees this facility's operating agreements and ask them specifically about the interpreter compliance window, and I'd like it on record that I raised this today. She stood up. If the review is moving forward, it's moving forward. But I'm going back to my floor now because I have patients, and the 3rd floor is running short. She walked out without waiting for his response. In the corridor, she leaned against the wall for exactly 3 seconds with her eyes closed. Not composing herself, she was already composed, but doing the thing she sometimes did when the cost of a thing caught up with her slightly behind the thing itself. Her hands were steady. Her heart rate was elevated by a number she could have measured if she'd pressed 2 fingers to her own wrist, but she didn't. She pushed off the wall and went to find Kowalski. Marcus Cole's surgery lasted 4 hours and 20 minutes. Megan was not there for most of it. She went back to the 4th floor and did her job, actually on the floor, physically present, covering the late afternoon in the way that charged nurses cover it, which is to say imperfectly and continuously, making the 10,000 small decisions that keep a clinical unit functional when there are not quite enough people and not quite enough time, and the margin for error is narrower than it looks from the outside. She checked on Ethan twice. Both times he was in the family waiting room. The first time he was asleep, actually asleep, curled sideways in the chair with his hoodie pulled up and his face slack in the specific way of children who have been running on stress for days and finally crash. And she left him there. The second time, at 6:15, he was awake and had been given a meal tray by someone on the family services staff, a small mercy that she noted without comment. He signed to her, "Any news?" She signed back, "Still in surgery. That's normal for this kind of operation." He accepted this. Then he signed, "Are you in trouble?" She looked at him. What do you mean? The man in the suit. I saw him come to talk to you. He paused. My dad says you can tell a lot about a hospital by how they treat the people who do the actual work. She almost smiled. Your dad's pretty smart. He's okay, Ethan signed with the particular expressiveness of an 8-year-old performing nonchalance, and she did smile at that. At 7:44, Dr. Strand came out of the OR. She knew because the charge nurse on surgical called her floor looking for the family liaison, who was not available, and the second call came to Megan because her name was the one attached to the Cole family in the communication log she had quietly updated that afternoon. She took the call at the nurse's station, standing up, with Kowalski pretending not to listen 4 feet away. Surgery was successful, Strand said. He sounded tired in the specific way surgeons sound when something has gone right but has taken everything they had to make it go right. Fragment is out, clean margins. He's in recovery. Thank you, she said. Miss Hart. A pause. I reviewed your notation in the chart. The one you entered at 11:08 this morning about the tremor presentation and the imaging flag. Another pause. You were right about all of it. She said nothing. I should have pulled the 2019 comparison myself, he said. That's on me. It's on a lot of people, she said carefully. The important thing is it got caught. Yes. He sounded like he wanted to say something else and was deciding against it. I'll be doing rounds in the morning. I'll speak to the family then. I'll let them know. She hung up and turned to Kowalski, who was absolutely not listening and had been performing intense interest in a supply catalog for the last 3 minutes. Cole family, she said. Surgery successful. Kowalski looked up with relief so transparent it was almost funny. Good, he said. Good. She walked to the elevator and rode down to the 3rd floor. Ethan was in the waiting room, awake, and he saw her face before she signed anything, and something in him went so visibly slack with relief that she felt it in her chest like a physical thing, the specific sensation of watching someone set down a weight. They have been carrying for so long, they have forgotten what it felt like to not carry it. She signed, He's okay. The operation worked. He's resting. Ethan stared at her for a moment. Then he pressed both hands flat against his face and sat forward in the chair, and she let him have that, just stood there in the middle of the waiting room while an 8-year-old boy who had spent 3 days not knowing whether his father was going to live tried to figure out what to do with the answer. After a while, he looked up at her. His eyes were red. He signed, Can I see him? Tomorrow, she signed. He needs to sleep tonight. He nodded. He wiped his face. Then he signed, Are you going home now? Soon, will you come back? She looked at him. She thought about Holloway's folder and Farrell's notepad and the formal review that was moving forward regardless of what had happened in the OR this afternoon. She thought about the message she had left for Patrice Odom and whether Patrice had listened to it yet. She thought about 3 things simultaneously, which was habitual, and underneath all 3 of them she thought about what Marcus Cole had said. They told us the specialist didn't make it, and the particular arithmetic of being a person who was supposed to be dead, according to someone's record somewhere, showing up in a hospital corridor 11 years later to catch the thing that was going to kill someone she'd once kept alive. Yes, she signed. She walked to the elevator and pressed the button for the 4th floor. When the doors opened, she stepped in and turned around, and through the gap before the doors closed, she could see Ethan still in the waiting room, watching the entrance with the steady attention that was his specific signature, but different now, she thought. Less like someone waiting for bad news and more like someone simply waiting. The way people wait when they know the person they're waiting for is coming back. The doors closed. Her phone buzzed. She looked at the screen. Unknown number, Virginia area code, a prefix she didn't recognize. She answered. The voice on the other end was male, measured, and had the particular quality of someone accustomed to having their calls answered on the first ring. Is this Megan Hart? It is. This is Rear Admiral Daniel Reyes. I understand you've been taking care of one of my people. A pause, short, deliberate. And I understand a gentleman named Holloway has been giving you some trouble. The elevator reached the 4th floor. The doors opened. Megan stood very still in the middle of the elevator while the doors began to close again, and she said, How did you get this number? Marcus gave it to me, Reyes said, before he went into surgery. He also told me something else. Another pause, longer this time. He told me where he recognized you from. And I need to ask you something, because if he's right, then I have a very significant problem that I've been trying to solve for about 11 years. The doors closed. The elevator began to move. What did Marcus tell you? Megan said. The elevator had stopped moving. She was on the 4th floor and the doors had opened and then closed again because she hadn't stepped out. And now it was sitting there with the particular patience of a machine that has no opinion about what happens inside it. He told me a name, Reyes said. The name on a file I've been carrying for 11 years. A file that says the person it belongs to died in a blast. Been carrying for 11 years. A file that says the person it belongs to died in a blast in Virginia Beach in 2013. A pause. The name on that file is Megan Hart. She pressed the door open button and stepped out into the 4th floor corridor. The unit was in its evening rhythm, quieter than the day, not quiet, the particular sustained hum of a place that never fully stopped. She walked to the window at the end of the hall and stood with her back to the corridor. Where are you? She said. Currently, about 40 minutes from Harwick. Another pause, briefer. I've been in the area since this morning. Marcus's admission triggered a notification through my office. I was already on my way when he called. She processed that. The consult flag in his chart. Yes. That was you. That was my office. We've been monitoring the fragment case since his last scan at Bethesda. The timeline was... He stopped. I'd rather have this conversation in person. I have a shift that runs until 2300. I know. I'll come to you. He paused again, and this time the pause had a different weight to it. Something more careful, more deliberate. The pause of someone choosing their next words with specific intent. Miss Hart, I want to be clear about something before I get there. Whatever conversation we have tonight is not an official inquiry. It is not a debrief. Nobody is asking you to account for anything. Marcus Cole told me you saved his life this afternoon, and that you probably saved it 11 years ago. And those are two separate things that I want to address in two separate ways. A beat. Do you understand what I'm telling you? She looked out the window. The bay was dark now, just the lights of the dock reflected in the water, broken into long smears by a wind she couldn't feel from inside. I understand, she said. Good. I'll be there by 2100. He paused. And Miss Hart, the administrator. Holloway. Don't engage with him again tonight. Whatever he's planning, let it sit until I get there. The line went quiet. She stood at the window for another moment, then turned and walked back into the unit. The next 2 hours were the kind of hours that existed in the gap between one thing and the next. The space where you kept doing your job because your job was the thing that kept the floor running and the patients alive, and because stopping was not an option and standing still felt like a form of dishonesty, like performing calm you didn't fully have. She had 4 patients on 4. She had a post-op patient who needed her dressing changed, a cardiac patient whose rhythm had been doing something irregular since 6 that she was watching, and an elderly veteran named Don Aldridge in room 408 who had been at Harwick for 11 days with a complicated pneumonia and who, for reasons she had never fully determined, had decided that she was the only person in the building worth talking to. She changed the dressing. She watched the rhythm. She talked to Don Aldridge for 8 minutes, which was 4 minutes longer than she had, about a dog he had owned for 12 years named Buster, who had died the previous spring, because Don Aldridge was lonely in the specific way that old men in hospitals were lonely, and it cost her 8 minutes and not much else. She documented everything she had done on the 3rd floor, not defensively, or not only defensively, but because the record was the record, and she had learned early that the version of events that existed in writing was the version that mattered when it came time to decide what had happened. She wrote it accurately, in clinical language, without editorializing, and she included the timestamp of every decision point. She included her note about the interpreter request. She included the timestamp on that too. At 8:47, Patrice Odom called. Patrice was 61, had been a nurse for 34 years, and had the quality of a person who had survived enough institutional weather to know when a storm was actually a storm and when it was a cloud that was going to pass. She did not waste words. I got your message, she said. Then I got a message from Holloway. Then I got a message from Strand. A pause. Your day sounds like it was a lot. Yes, Megan said. Walk me through the imaging situation, from the beginning. She did. She kept it tight. 3 minutes, the relevant facts in order, the The clinical basis for every decision, the outcome. Patrice listened without interrupting, which was unusual for her. When Megan finished, there was a silence that lasted long enough to mean something. The interpreter gap, Patrice said. You said 71 hours. 71 hours from the family's admission timestamp to the time I submitted the request. The request is still unactioned. I'm aware. Another pause. Holloway's formal review notice is going to hit your file tomorrow morning. HR has already generated the paperwork. I know. Are you going to fight it? Megan thought about Reyes D., who was 40 minutes from this building and had told her to let it sit. Not tonight, she said. Patrice made a sound that might have been acknowledgement or might have been something more complicated. The cold case is going to generate an incident report regardless. Strands documenting the clinical pathway. That's going to be its own thing. A pause. Megan, is there something I should know about you specifically? She thought about how to answer that. There might be, she said, by tomorrow morning. Patrice absorbed this. All right, she said. I'm not going to pretend I know what that means. A pause. For what it's worth, what you did today was right. The review is about process. Those are two different things. I know, Megan said. I've always known they were different things. She hung up and went to check on Don Aldridge's oxygen saturation. Rear Admiral Daniel Reyes arrived at Harwick Naval Medical Center at 9:04. Megan knew this not because anyone told her, but because at 9:03, the nursing supervisor on the third floor called the fourth floor station to say that a flag officer had arrived at the main entrance, had bypassed the visitor check-in, and was asking for the charge nurse on 4 by name. By the time she got to the elevator, he was already getting out of it. He was 63, she guessed, though he looked younger in the specific way of men who had spent their lives in physically demanding work and had the posture to show for it. He was in civilian clothes, a dark jacket, gray shirt, the kind of understated precision of dress that people who spent most of their time in uniform wore when they weren't. He had the kind of face that had done a lot of things and stopped performing all of them, just the residue of experience left over. He looked at her for a moment before either of them spoke. It was not the look of a man seeing a ghost, exactly. It was more controlled than that. But there was something in it, a slight adjustment. The look of someone whose mental image of a person has just been replaced by the actual person standing in front of them. Miss Hart, he said. Admiral. Dan, he said. Tonight. She took him to the conference room on 4, which was smaller than the one on 3, and had a better view of the parking structure, which was not a selling point, but was the option available. She closed the door. He sat down. She did not. Marcus is out of recovery, she said. They moved him to the surgical ICU at 8:30. He's stable. I know. I stopped by the SICU on the way up. He looked at her steadily. He recognized you before the surgery. He recognized my hands, she said. I'm not sure it's the same thing. He seemed certain. He was in a hospital bed with a shifting cranial fragment and a scheduled sedative he didn't know was going to kill him. His certainty might have been contextual. Reyes looked at her with the particular expression of a man who is deciding whether to address something indirectly or directly, and who has decided, after a very brief consideration, on direct. Were you at the Virginia Beach operation? November 2013. EOD support. USS Caldwell Marine Unit quarantine breach. Secondary device activation. She sat down. Yes, she says, she said. You went into the secondary device room. Yes. Alone. The team lead was down. The next senior operator had a compound fracture. The device had 4 minutes on it. She paused. Yes. The blast threw you into the structural wall. The initial report listed you as killed in action. That report was based on a visual assessment by a team member who saw you go down and could not confirm vital signs before they had to move. He was speaking steadily, not reading from anything, the way people speak when they have had a long time to know something by heart. You were extracted by a civilian contractor working the perimeter. He took you to a private medical facility in Norfolk, rather than a military hospital, because the operation was partially classified and he was following the wrong protocol. She said nothing. The contractor filed an incident report 6 months later. By that time, the operation file had been closed with your status listed as KIA. The report was flagged at the JAG level, and then somehow fell into a review queue that nobody was actively managing, and by the time I found it, you had been separated from service. Medically, under a different process that treated you as a new case without the KIA flag attached. And we're working here. He paused. Your hearing loss. Left side complete, right side 60%. You hide it well. I've had practice. You're not wearing a hearing aid. I lip read, she said. Well enough. In controlled environments, loud rooms are harder. Virginia Beach was loud, he said. Yes. The room was quiet for a moment. Through the wall, she could hear the sounds of the unit, the distant beep of monitors, the low exchange of the night nursing staff, the ordinary ambient noise of a place that ran continuously and had no off position. Reyes put both hands flat on the table. It was a deliberate gesture, the kind that was meant to indicate something. Openness, she thought, or at least the intention of it. There's a record problem, he said. You are officially listed as killed in action in a classified file that has been sitting in a review queue at the JAG office for 11 years. The record of your medical separation exists in a different system as a separate person, or rather, the same person, but without the KIA flag, which means the two records have never been reconciled. He paused. Which means, technically, that the Navy has no coherent official position on whether you are alive. She looked at him. I've been paying taxes. That's a civilian record. The military file is... He stopped. It's a mess. It's a mess that I should have caught years ago and didn't, because the flag got buried and nobody was looking, and you were apparently not making noise about it. I wasn't going to make noise about it, she said. Why? She thought about it. Because I was tired, she said finally, and because I had a job, and because the thing that mattered was that the device didn't go off, and 19 men got out, and the paperwork seemed like a problem for another time. Reyes looked at her for a long moment. Another time has arrived. Apparently, he leaned back in his chair. I want to fix the record. That's the first thing. It requires your consent and some documentation, and there's a process, and the process is going to take longer than tonight, but I can initiate it tonight. He paused. The second thing is that your separation, the medical separation that happened under the incorrect record, should have included benefits and recognition that it did not include, because the file it was processed under didn't have the full operational picture. I'm not interested in pursuing benefits, she said. I know you're not. I'm telling you anyway, because it's yours, and because the record needs to be right regardless of whether you want anything from it. He paused. And the third thing is Holloway. She waited. Marcus told me about the interpreter situation before he went into surgery. He was, Reyes chose his word carefully, emphatic. He also told me about his son, and the 3 days, and the way Holloway handled this morning. He looked at her steadily. Holloway has a formal review pending against you. I'm aware. I have some thoughts about that. I'd imagine you do, she said. Something in his expression shifted, not quite a smile, but the movement around it, the acknowledgement of one. You were briefed on military oversight processes during your service, extensively. Then you know that when a flag officer has material information about an incident involving a military medical facility and a military family, there are reporting obligations that exist independent of the facility's internal administrative process. She looked at him. You're going to file a report. I'm going to do several things, he said. Tonight I'm going to document my conversation with Lieutenant Cole and my arrival at this facility. Tomorrow I'm going to speak with hospital administration, not Holloway, above Holloway. This facility has a commanding officer, and that CO has a relationship with my office that I intend to make use of. He paused. Holloway's review of you is going to run into some competing information. Competing information, she repeated, the kind that tends to recontextualize things. She looked at him for a moment. She thought about Holloway's composed expression across the conference room table, and Farrell's notepad, and the formal review paperwork that was going to hit her file tomorrow morning. She thought about what Patrice had said. The review is about process, what you did today was right, those are two different things. And she thought about how many years she had spent knowing that those two things were different and navigating the gap between them. I don't need you to fight my battles, she said. I know that, Reyes said. You demonstrated that fairly thoroughly today. But there's a difference between fighting your battles and correcting a record. He paused. Holloway tried to silence someone who saved a Navy officer's life because she went outside a process. That's a different kind of record. That one I'm going to correct. She went back to her floor. There was no dramatic moment when she left the conference room, no clear resolution, no neat closing of a loop. Reyes stayed to make calls. She went to check on her cardiac patient, whose rhythm had stabilized during the hour she'd spent downstairs, and then she went to look at Don Aldridge, who was asleep, and then she stood at the nurse's station for a few minutes, doing nothing in particular except letting the shift happen around her the way it always did, imperfectly, continuously, without pausing to accommodate the weight of everything that had accumulated over the course of the day. At 10:15, she went back to the third floor. She did not have a clinical reason. The Cole case was in the SICU, which had its own staff, and Ethan was technically the responsibility of the Family Liaison Office, which had finally, 12 hours after her request, arranged for a social worker to be with him through the night. She went because she wanted to see him, which was a want she would not have articulated to anyone, because it was personal, and she did not make a habit of personal things in this building. He was asleep in the waiting room. The social worker, a young woman with braids and a name tag that said Thomas, was sitting in the chair adjacent, reading something on her phone. She looked up when Megan came in. "He went out about 20 minutes ago," Thomas said quietly. "Has he eaten?" "Twice. He was hungry." She glanced at Ethan. "He talks about you. Signs, I mean. I don't sign, but I've been looking things up on my phone and he's been very patient about it." She paused. "He said you used to do something like what his dad does." "A long time ago," Megan said. "He said he wants to be a doctor." "I know." She looked at him, the gray hoodie, the coal stenciled inside the collar, the way he slept with his face turned toward the room entrance even in sleep, some part of him still watching. "Make sure someone tells him when his dad is moved out of the SICU. He's going to want to know as soon as it happens." "Of course." She started to go. Then Tomas said, "Miss Hart, he asked me something earlier and I didn't know how to answer." She paused. "He asked if the reason you knew how to sign was because of a deaf person you used to know, someone important." Megan stood in the doorway. She thought about a man she had worked alongside for 2 years in the kind of conditions that stripped everything non-essential away and left only the thing you actually were underneath. A man named Warren, who had been a better medic than anyone twice his age, and who had been deaf since childhood, and who had taught her sign language in increments over 18 months, showing her each hand shape with the patient exasperation of someone who had given up expecting people to meet him where he was, and had instead, with characteristic efficiency, decided to go get them. Warren had made it out of Virginia Beach. I was working at a children's hospital in Raleigh now, or had been the last she'd heard, which was 3 years ago, which was a gap she had been meaning to do something about for 3 years. "Yes," she said. "Someone important." She went back to her floor. The incident happened at 11:41, 19 minutes before her shift ended. It started in room 406. A patient named Alan Trask, Army, 44, admitted 2 days earlier for what had presented as a routine gastrointestinal bleed and had been managed conservatively with transfusion and monitoring. His hemoglobin had been trending stable since morning. Megan had checked his vitals at 10:30 and noted nothing alarming. At 11:38, his call light came on, which she noted and assigned to the float nurse, who was in another room. At 11:41, the monitor at the station alarmed. She was the one standing at the station. She was already moving when the second alarm followed the first. Trask was on his back with his face the gray-white color that hemoglobin in freefall produced, and his blood pressure on the wall monitor was 64 systolic and dropping. Not a slow drift, a fall. The kind of number that meant the bleed had restarted and had restarted badly. She hit the call button and went to the door simultaneously. "Get me Kowalski and call rapid response," she said to the station, which was not Kowalski. It was a nursing assistant named Petrov who had been there for 6 weeks. But Petrov was already reaching for the phone because the alarm was still going, and the number on the monitor was not compatible with the absence of urgency. Trask was conscious, barely. He looked at her with the particular frightened clarity of someone who knows something is very wrong and does not know what to do with that knowledge. "I've got you," she said. "Stay with me." She pulled the IV port, assessed it, patent, good flow, and pulled the emergency supply from the wall cabinet while calling over her shoulder for the type and screen, which was already in the chart from admission, which meant there was blood available if she could get it here in time. She elevated his legs with the bed controls, which was not a permanent solution and was not meant to be. It bought minutes. The question was what you did with the minutes. The rapid response team arrived in 3 minutes and 40 seconds, which was within the standard and felt like a very long time. There were 5 of them, the resident on call, an ICU nurse, a respiratory tech, 2 more from MedSurg. They moved with the organized efficiency of a team that had run this drill enough times to do it without narrating it. Megan stepped back. Not all the way back. She stayed in the room, monitoring, passing the information the resident needed without being asked for it. The history, the previous transfusion volumes, the exact time of the alarm, the blood pressure trend. She had learned, in other rooms and other contexts, the specific discipline of being useful without being in the way. The difference between knowledge and authority, and how to offer one while deferring to the other without losing either. The resident, Hoang, first year, good hands, too much eye contact when he was unsure, got a second large-bore IV established in 90 seconds and called for the blood. Trask's pressure stabilized enough to be moved. They took him to the ICU at 12:06. Megan stood in the empty room after they left and breathed for approximately 15 seconds. The room smelled like the particular combination of antiseptic and stress that she had been breathing since 7 that morning, and her feet hurt in the specific way they hurt after 17 hours of a shift that had started at 6 a.m., and she had paperwork to file on Trask and a handoff to do for the night nurse who was supposed to have taken over 4 of her patients 20 minutes ago. She did the paperwork, she did the handoff. She wrote the incident note on Trask with the same flat factual accuracy she had used for everything else today, and she included the time of the alarm, and the time she responded, and the time the rapid response team arrived and what she had done in the gap. She clocked out at 12:31. Reyes was in the parking structure, not waiting for her, or not only waiting for her. He was on the phone when she came through the exit, standing beside a dark SUV with government plates, and he held up a hand when he saw her, finished the call in 30 seconds, and put the phone away. "Long shift," he said. "Patient rebelled in the last 20 minutes. He's stable." She stopped walking. The parking structure was cold in the way of concrete structures near water, a damp, persistent cold that got into things. "I thought you were making calls." "I did, and then I sat in the SICU for a while and watched Marcus sleep, which is something I do when I don't know what else to do." He said it without apparent self-consciousness, the way people said things they had decided there was no point in being embarrassed about. "He's going to be fine. Strand said the surgical margins were clean and there's no indication of vascular compromise." "Good." "I made 3 calls tonight," Reyes said. 1 to JAG to initiate the record reconciliation, 1 to the hospital's commanding officer, and 1 to the Inspector General's office. She looked at him. "The interpreter gap," he said. 71 hours for the deaf child of an active duty service member is not an administrative irregularity. It is a compliance failure, and it has a paper trail, and I am formally requesting that it be reviewed by someone outside this facility's chain of command." He paused. Holloway is going to have a conversation tomorrow morning that is not the one he was planning to have. She absorbed this. "You moved fast." 11 years of a file sitting in a review queue tends to make a person impatient with delays. He looked at her steadily. "There's one more thing. Your official record, the reconciliation. When it processes, it's going to include a commendation for the Virginia Beach operation. That was supposed to happen in 2013. It didn't because of the file problem. It's going to happen now." She looked at him for a moment. She thought about commendations, what they were and what they weren't, what they represented and what they failed to represent. The gap between a notation in a file and the actual thing that happened in a room with a device, and 8 minutes and 19 men outside who didn't know yet. "I didn't do it for a commendation," she said. "I know. The commendation isn't for you to feel recognized. It's so the record is accurate." He paused. "Those are different things." She looked at her hands in the poor light of the parking structure, the scar across the right knuckle, the slight asymmetry in the left. "You need to go home," Reyes said. Not unkindly. "We'll continue this tomorrow. I'm meeting with the CO at 0800, and I'd like you to be available for a conversation with JAG later in the morning if you're willing." "What time?" 10. "Here, probably. They can come to you." She nodded. She was tired in a way that had moved past the physical and into something else. Not exhaustion exactly, but the specific heaviness of a day that had been too many things. The accumulation of everything from Ethan's hands in the hallway to Marcus's expression when he'd said they told us the specialist didn't make it to Holloway's composed voice across a conference table to Trask's blood pressure in freefall, and the 17 seconds it had taken her to get the IV line assessed. She had made 1,000 small decisions today, and most of them had been right, and the ones that hadn't she already knew about, and she was going to go home and sleep and come back tomorrow and do it again. "One more thing," Reyes said. She looked at him. "The man who ran the EOD team in Virginia Beach," he paused. "Chief Warrant Officer Garrison. He retired 2 years ago. He's been trying to find out what happened to you for 11 years. She said nothing. "He's going to find out tomorrow," Reyes said. "When the record processes, it generates a notification to the original unit commander. Garrison is on the notification list." He paused. "I thought you should know that before he contacts you." She stood in the cold of the parking structure with that information for a moment, turning it over. Garrison. She had not let herself think about Garrison in a long time, for reasons that were specific and complicated and had to do with the particular weight of being responsible for people who thought you were dead. "All right," she said. She walked to her car. She was 3 rows in, under a flickering light that had been flickering for at least 2 months. She got in, put the key in, and sat for a moment before she started it, because she had learned to give herself the space of a moment before she transitioned between things. It was not a meditation practice or a breathing exercise or anything with a name. It was just a moment. She started the car. Her phone lit up on the passenger seat. Unknown number. The same Virginia area code as Reyes's call, but a different prefix. She looked at it. The phone rang again. And again. Patient, even-paced. The rhythm of someone who was going to keep calling because they had been waiting 11 years, and a few more rings was not going to deter them. She reached for it. And then her radio, the hospital radio she still had clipped to her bag from the shift, which she hadn't yet returned to the charging station, came alive with a voice she recognized. Kowalski, on the 3rd floor channel, speaking fast. "Rapid response to the SICU. Rapid response to the SICU. Cole, Marcus. Cardiac event in progress." Her hand stopped moving toward the phone. The radio repeated. "Cardiac event in progress. Room 7. Marcus Cole was in room 7 of the SICU. She had noted it when they moved him. Strand had said the surgical margins were clean. Reyes had said he was going to be fine. Strand had said the surgical margins were clean. She started the car, shoved it into reverse, and was out of the parking space before the radio stopped repeating. She left the car running. Not intentionally. She got out in the parking structure with the engine still on and the door still open and was 20 feet away before she registered it, and she made the calculation in about half a second that going back was going to cost her time she did not have. She left it. The parking structure had a barrier gate, and nobody was going to take it in the next 15 minutes, and if they did, it was a problem for after. She went through the side entrance with her badge, which still worked because her shift had technically ended 20 minutes ago, and the system gave a 30-minute grace window, something she had never had cause to be grateful for before now. The SICU was on the 2nd floor. She took the stairs. The SICU had its own physics. It was not like the rest of the hospital. It was smaller, more contained, with a specific density of equipment and attention that made every sound carry differently, every movement register. She had spent time in ICUs that made Harwick's look like a closet, in places where the intensive care was delivered in tents with generators. And she had the muscle memory of those places, the way your body recalibrated when you walked into a space where the margin was thin. She could see room 7 from the entrance. The rapid response team was already there, 5 people around a bed, the specific organized chaos of a team working a cardiac event, controlled noise, the stutter of the defibrillator charging, someone calling numbers. She stopped at the threshold because she had no clinical authority in this room, and walking into a working resuscitation without authority was the kind of thing that got people hurt, and she stood there and watched and did the thing she had gotten very good at, which was reading what was happening from the edges. Marcus Cole was not flatlining. He was in a rhythm. She could see the monitor from the doorway, could read the waveform. And it was not a rhythm that was going to kill him in the next 60 seconds. But it was also not a rhythm that was supposed to be there after a clean posterior fossa surgery. It was a junctional rhythm, slow and inadequate, the kind that appeared when the cardiac conduction system had been stressed in a very specific way. The resident working the case, not Hoang, someone she didn't recognize, night rotation, was calling for a pacing pad, which was correct. The ICU nurse had the medication tray open. Someone in the back was on the phone, probably with cardiology. Reyes appeared beside her. He had come up the stairs behind her, she realized, or taken the elevator she hadn't checked. He was breathing with the controlled steadiness of someone who had run and was not going to show it. He looked at the room. What happened? Junctional bradycardia, she said. He's perfusing. The monitor shows he's conscious. It's not the fragment. This is cardiac. Was this expected? Not from the surgery. She watched the resident apply the pacing pads. Posterior fossa procedures can occasionally affect the vagus nerve. It's rare. Strand should have had a cardiology consult in place for the first 24 hours. She paused. I don't know if he did. Reyes looked at her. Is he going to be all right? If they pace him and cardiology gets here in the next 15 minutes? Probably yes. She kept her eyes on the room. The pacing pad will hold him until they can... Yes, good. The resident had initiated transcutaneous pacing. On the monitor, the rhythm stabilized into something that looked like a heartbeat that was going to keep beating. That's going to hold, she breathed. Reyes put a hand briefly on the door frame. Not a dramatic gesture, just a hand on a surface, the way people needed something solid when something they had been afraid of started to recede. The resident came out 3 minutes later. He was young, mid-20s, with the specific expression of someone who had been more scared than they were going to admit. Are you family? He said, looking at Reyes first, then at Megan, with the confusion of someone who recognized her scrubs and her badge, but also knew her shift had ended and was not sure what category she fell into. I'm his commanding officer, Reyes said. She's the charge nurse who managed the initial fragment identification today. What happened? The resident, his badge said Fletcher, straightened slightly at the tone. Vagal event, we think. His heart rate dropped into the 30s around 2200, 2215. He presented atypically. The monitoring alarm threshold wasn't set aggressively enough for a post-surgical patient. Who set the threshold? Megan asked. Fletcher looked at her. The admitting SICU nurse. It would have been set at... He stopped. Standard protocol for surgical admit is to adjust the lower threshold to 50 in the first 24 hours post-op. The threshold was set at 40. The difference between 40 and 50 beats per minute was, in this situation, the difference between an alarm sounding 4 minutes earlier or not at all. She looked at Fletcher. He was doing the math himself in real time, and she watched him arrive at the conclusion with the uncomfortable transparency of someone who is very tired and not yet good enough at hiding the moments when they understood the full shape of what they were looking at. He's stable now, Fletcher said. The pacing is holding and cardiology is on the way. We're going to get a full read and probably discuss overnight pacing versus medication management. I want to know what the cardiology team finds, Reyes said. Tonight, not in a morning report. Yes, sir. Fletcher went back into the room. Megan stood in the corridor. She was wearing her coat over her scrubs because she had been going home when the radio had called, and she was standing in a hospital at 20 minutes past midnight having not gone home, and her feet still hurt from the hours before that. Go home, Reyes said. I was trying to. He's going to make it through tonight. Fletcher is going to page cardiology. Cardiology is going to have a very alert night because I'm going to make a call in approximately 5 minutes. And Marcus Cole is going to wake up tomorrow with a pacemaker discussion and his son in the chair beside his bed. He looked at her steadily. Go home. She looked at room 7 through the glass. Marcus was conscious. She could see his hand on the sheet, the left one, the one that had been tremoring all morning, and it was still. The tremor was gone. Whatever the fragment had been doing to the peripheral nervous system, the surgery had corrected it, and the hand that lay against the white sheet was just a hand, quietly, without the involuntary percussion of something wrong. She went home. She slept for 5 hours and 20 minutes, which she knew because she looked at the clock when she closed her eyes, and again when she opened them, a habit she had never been able to break. She made coffee. She looked at her phone, 6 messages, which she did not read in order of arrival but in order of apparent urgency, which was a different order. One from Patrice, marked 11:15 p.m., which said only, "Call me when you're up." News. One from an unknown number that she was reasonably certain was Garrison, which she was not ready to address before coffee. Two from the hospital system, automated, about schedule changes. One from Reyes, time-stamped 2 a.m. Cole is stable. Cardiology placed a temporary pacemaker. Longer conversation to come. Sleep. And one from a number she recognized as the hospital's main administrative line, time-stamped 6:51 a.m., which was 12 minutes ago. She called Patrice first. Holloway came in early, Patrice said. She sounded like she had also not slept enough. He was here at 7. He had the review paperwork and he was going to walk it to the CO's office himself. Was going to, Megan said. The CO wasn't available. Apparently the CO had a 7 a.m. meeting with a flag officer and the meeting had been going on for 40 minutes when Holloway showed up. A pause. Holloway doesn't know about Admiral Reyes yet, or he didn't, as of 7:15. Megan drank her coffee. He's going to figure it out. He's going to figure it out very soon, Patrice said. There are also 2 people from the JAG office in the building. They came in through the CO's entrance at 07:30, and they have not left. Another pause. The nursing staff is aware that something is happening. I'm not telling them anything specific because I don't know anything specific. But Megan, her voice shifted slightly, the supervisory tone replaced by something more direct. Whatever is about to happen, I need to know enough to manage the floor. Can you give me something? There's a military record issue connected to a patient, Megan said carefully. And there's a compliance failure on interpreter access that's being formally reviewed by an outside office. Those are the 2 things. She paused. The compliance failure is connected to Holloway's administrative decisions. Patrice was quiet for a moment. How connected? Documented. For 8 months. Another silence. All right, Patrice said. All right, come in when you can. This is going to be a day. She was in the parking structure. Her car, she noted, was exactly where she'd left it, engine off, because she had apparently turned it off on autopilot sometime during the night without any recollection of doing so, by 8:47. The hospital had a different atmosphere when she walked in. She had worked there long enough to read the place the way you read any environment you knew well. Not consciously, not by looking for specific signals, but by the accumulated sense of it, the temperature of the air, the way people moved in the corridors, and the things they said and didn't say to each other. Today it felt like a building that was waiting for something, a low-grade alertness that hadn't been there the day before. She went to the SICU first. Marcus was awake. He was propped up slightly with the specific careful posture of someone who has had their chest opened and closed in the last 12 hours and is aware of every centimeter of it, and the temporary pacemaker lead was visible at his collar, and he looked like a man who had been through something and come out the other side of it and was currently taking stock of what the other side looked like. Ethan was in the chair beside him. He was asleep, or had been asleep, and woke when she came in, the way he woke, which was complete and immediate, no gradual surfacing. He saw her and signed before she had cleared the doorway. He's awake. I can see, she signed back. She looked at Marcus. He looked at her. He had the particular expression of a man who has had a night to think about things and has arrived at some conclusions. Reyes told me, he said. His voice was rough from the intubation during the original surgery. About Virginia Beach, about the record. He told me he would. He also told me... He stopped. Worked something out. He said you didn't know the record was wrong, that you weren't hiding, that you just moved forward. There wasn't a lot of reason to go backward, she said. Marcus looked at her for a long moment. He had the eyes of someone who had spent a career in environments that required honesty, and who therefore could not perform gratitude without it meaning something. I've thought about Virginia Beach a lot, he said. The 11 of us who made it out of that secondary room. We were told you didn't make it. We were... He stopped again. I want to say something, and I don't want it to sound like what it's going to sound like. Say it anyway. It changed something, he said, knowing you didn't, that you were here. He paused. It matters. She looked at him. She thought about the particular weight of being alive in a way that had been miscategorized, and about the years between Virginia Beach and this room, and about what it meant for a thing to matter. Your son is a good kid, she said. Marcus looked at Ethan, who had been tracking the conversation with focused attention, even though he couldn't hear the spoken parts. He signed something to his father, a question, and Marcus signed back. A brief exchange she read without intruding on. She's okay. She came to check on us. And Ethan, good. She left them to it. The meeting was in the CO's conference room on the administrative floor. She had not been to the administrative floor more than twice in 3 years. It was the kind of floor that existed in a different register from the clinical units, wider corridors, actual carpet, the ambient sound of an institution managing itself rather than caring for people. Captain Denise Yarbrough ran Harwick Naval Medical Center with the specific blend of military precision and institutional pragmatism of someone who had been doing it for 6 years and intended to keep doing it, which meant she had a finely calibrated sense of which problems were administrative and which were going to reach past the facility's boundaries. The JAG officers were Lieutenant Commander Sylvia Okoro and a junior officer named Briggs, who took notes and did not speak. Reyes was there. Patrice was there, at a seat near the door, which Megan thought was Yarbrough's way of including nursing leadership without centering it. There was a civilian from the Inspector General's office whose name Megan didn't catch, and who wore the expression of someone who had attended many of these meetings and had learned that the most useful thing they could do was observe. Holloway arrived at 9:02. He came in and read the room in about 4 seconds. The JAG officers, the IG representative, Reyes in the corner, Megan sitting across the table, and his face did something complex and rapid that resolved into the composed mask he defaulted to, but not quite as cleanly as usual. There was a beat of hesitation before he sat that he hadn't intended. Yarbrough ran the meeting. She was direct and formal in equal measure, and she did not perform any emotion about what she was presenting, which was a summary of the events of the previous day, the interpreter compliance gap, and the concurrent military records issue involving Megan Hart. She laid it out in order. The family's admission date, the intake notation documenting Ethan's deafness, the 2-hour compliance window, the 71 hours, the request Megan had submitted, the timestamp on that request, the timestamp on when it entered Holloway's inbox, the timestamp on when it had been actioned, which was sometime the previous evening, after Reyes had made his call to the CO and the CO had made her own inquiries. Holloway listened without interrupting. He was good at listening. It was one of the things that made him effective, the ability to let information arrive without reacting to it in real time, to wait until he had the full shape of it before deciding how to respond. She watched him doing it. She watched him take in the interpreter timeline and the compliance window and the IG representative in the corner, and she watched him arrive, somewhere in the middle of Yarbrough's presentation, at the understanding that the meeting he had prepared for was not the meeting he was in. With respect to the interpreter issue, he said, when Yarbrough paused, the facility has been managing a resource constraint that, Mr. Holloway, Okoro's voice was pleasant and carried no apparent heat, which was the specific quality of someone whose authority did not require heat to function. The compliance window under the facility's operating charter is 2 hours. The gap in this case was 71 hours. A resource constraint is a mitigating factor that belongs in a formal response to an IG finding. It is not a response to the finding itself. Holloway looked at her. I understand that. Good. She made a note. We'll want your documentation on the resource constraint claim. Specifically, any records showing that interpreter services were requested through appropriate channels and denied at the budget level. A pause. Not a long pause, maybe 2 seconds, but a specific one. The pause of a man who has just been asked to produce documentation that does not exist in the form he would need it to exist. I'll have my office compile that, he said. By end of week, Okoro said. Yarbrough moved to the second item, which was Megan's record and the actions Holloway had taken against her. She presented this with the same flatness, the review notice, the formal paperwork, the employment threat. She included the timestamps on those as well. The IG representative, who had not spoken until this point, said, Mr. Holloway, at the time you initiated the review against Miss Hart, were you aware that she had identified a potentially fatal clinical condition in a patient? The clinical outcome was not, that wasn't the question. Holloway looked at him. I was aware that she had raised a concern that was being assessed by the clinical team. Were you aware that the sedative she was attempting to prevent from being administered was, according to the subsequent surgical team's assessment, contraindicated given the patient's condition? A pause. I am not a clinician. No, but you are the person who threatened her employment in the window between her raising the concern and the clinical assessment confirming it. The IG representative made a note. That's a documented sequence of events. I want you to understand that we're going to be looking at it carefully. Reyes had not spoken during the meeting. He had sat in the corner with his hands folded on the table and his expression neutral, in the way of someone who is content to let a process operate without adding to it. Now he looked at Holloway directly, and Holloway looked back, and what passed between them in that moment was not language but something that functioned like it, a recognition, mutual and clear-eyed, of where they were relative to each other and what that meant. "Admiral," Yarbrough said, "is there anything you want to add to the record at this point?" "Two things," Reyes said. "First, the formal commendation for the Virginia Beach operation that should have been filed in 2013 is being submitted through my office today and will be on record by close of business." He looked at Megan. "That should have happened 11 years ago. It didn't, for reasons that were not Miss Hart's failure. It's happening now." He looked back at the table. "Second, I want the interpreter program at this facility reviewed and resourced within 30 days. Not scheduled, not planned, resourced. I'm aware of what the budget priorities in this building have been for the last fiscal year, and I am aware of what did and did not receive funding. Find the money." He said that last sentence without inflection, the way people say things they are not asking permission for. Holloway said carefully, "The budget allocation process—" "Find the money," Reyes said again. "You found it for the lobby renovation in March." The meeting ended 20 minutes later without resolution in the formal sense. There were processes to complete, documentation to file, reviews to conduct, but with the specific quality of a balance that had shifted. Holloway left first. He walked out with the composed posture he had come in with, unchanged on the surface, but with the particular gait of someone who had recalculated a situation and was moving through the recalculation in real time. Megan watched him go. She stayed in her seat for a moment after the room began to clear. Patrice stopped beside her on the way out and put a hand briefly on her shoulder. A small, deliberate thing, the kind Patrice did not do often. "Come to the floor when you're ready," Patrice said. "No rush." Okoro stopped at the door. "Miss Hart, the review notice that was filed against you, we're going to recommend it be withdrawn given the circumstances. That recommendation goes to the CO's office. Yarbrough will make the call." "Thank you," Megan said. Don't thank me. The timeline did it." Okoro paused. "You documented everything very carefully." "Habit," Megan said. Okoro almost smiled. "Good habit." She left. Reyes stayed. He waited until it was just the two of them in the conference room, and then he said, "Garrison called me this morning. He got the notification from the record processing. She had been expecting this." "How was he?" Reyes considered. "He said, and I'm paraphrasing, that he had been carrying the wrong version of events for 11 years, and that finding out the right version made him angry and relieved in equal measure, and that he was going to need a few days." He paused. "He asked if he could reach out to you directly." "Yes," she said. "I'll let him know." He stood, straightened his jacket in the automatic way of someone with decades of muscle memory for it. "The commendation is going into your record as an addendum to the separation file. It's going to note the Virginia Beach operation specifically, and it's going to name you." He paused. "Some people will see it. People who knew about that operation. People who knew your name in connection with it." She thought about that. She thought about what it meant to be named in a record after 11 years of not being named in it. Not the performance of it, not the public aspect, but the simple factual correction of a thing that had been wrong. "All right," she said. "There's one more thing," Reyes said. Something in his tone made her look up. "The IG review," he said. "It's going to go broader than today's meeting suggests." He paused. Okoro's office requested Holloway's budget records going back 18 months. Personnel decisions, resource allocations, the interpreter program funding specifically. He looked at her steadily. "What they found in the preliminary review, and this is not public yet, is that the interpreter program was not defunded because of a general budget constraint." She waited. "It was defunded because Holloway redirected the line item," Reyes said. "Specifically, he transferred the interpreter services allocation to a different budget category in the fourth quarter of last year. The reallocation was within his administrative authority at the time, which is why it didn't trigger an automatic flag." He paused. "What it did trigger, when Okoro's office started pulling the thread, was a pattern. What kind of pattern? The kind where money moves from service-facing programs to administrative overhead, and the decisions are individually defensible but collectively paint a picture of someone who is optimizing for the wrong things. He looked at her. He's been at this facility for 6 years. The IG review is going to go back 6 years. She absorbed this. She thought about Ethan in the waiting room for 3 days with no interpreter and the family liaison who did not sign. And Holloway saying that's a resource allocation issue. It's on the administrative schedule with the tone of someone who had said that sentence many times to many people. She thought about all the patients before Ethan, all the families who had come through Harwick with communication needs that the interpreter program had been supposed to serve, during the months that it had not been funded, during the months before that when it had been underfunded. How many families? She said. We don't have a number yet. His voice was even. Okoro's office will determine that. She sat with that for a moment. She was not a woman who performed righteousness. She did not feel, in this moment, the clean satisfaction of a thing resolved. What she felt was more complicated, the specific weight of understanding that a failure large enough to have a pattern was a failure that had affected people she would never meet, in moments she would never know about, in the gaps of a system that was supposed to be there and wasn't. She stood up. She picked up her jacket from the back of the chair. I'm going to go check on my patients, she said. Reyes nodded. Megan. It was the first time he had used her first name, and it landed differently than her surname. What you did yesterday, the fragment, the sedative, the documentation, all of it. He paused. It was right. Not just the outcome, the judgment. She looked at him. She thought about how to receive that. She thought about judgment, what it was, where it came from, what it cost to develop it, what happened when you used it, and were right and were also still, simultaneously, the person who had done something outside the process. Both things could be true. They generally were. Thank you, she said. She walked out into the corridor. The administrative floor had the carpet and the quiet that it always had, but today it felt different. Not the quiet of a building managing itself, but the quiet of a building that had had something turned over in it, something examined in a way it was not accustomed to being examined. She walked to the elevator and pressed the button for 4, and while she waited, she thought about what Reyes had just told her. Holloway's budget records. 18 months, 6 years. She thought about the pattern he had described, money moving, decisions individually defensible, collectively pointing somewhere. She had worked in environments where that kind of pattern meant something specific, where the space between individually defensible and collectively wrong was the space where accountability lived. The elevator arrived. She got in and pressed 4. The doors were closing when her phone buzzed. She looked at the screen. Patrice. She answered. You need to come to 3, Patrice said. Her voice had the clipped quality it got when she was managing something and did not have time to frame it. Holloway is down here? What's he doing on 3? He went to the Cole family room. He's been in there for 4 minutes. A pause. Short, pointed. Ethan is in there alone. The elevator doors were fully closed. She was going up. She pressed 2, then 3. Pressed it again, harder, which was not how elevators worked, and she knew that, but her hand did it anyway. I'm coming, she said. He says he's there on behalf of hospital administration, Patrice said. He says it's a routine family services check-in. Her voice went quieter. Megan, Ethan can't hear what he's saying, and Holloway knows it. The elevator reached 3. She was out before the doors were fully open. The family consultation room on the 3rd floor was a 12 by 14 space with 2 chairs, a small couch, a window that looked at the parking structure, and a box of tissues on the table that nobody ever touched, because the people who ended up in that room were generally past the point where tissues helped. It had a door with a narrow vertical window beside it, and through that window Megan could see Holloway standing near the center of the room with his hands clasped in front of him in the posture he used when he was performing reasonableness, and Ethan in the chair against the wall with his knees pulled up and his face doing the specific careful blankness of a child who has learned that when adults speak and you cannot hear them, the safest thing is to show nothing. She opened the door. Holloway turned. Something moved across his face. Surprise, recalculation, the rapid reassembly of his composure, and then the composure was back, intact, the mask so practiced it arrived almost before the expression it was covering had finished. Miss Hart, he said, this is a private family consultation. "He's 8, she said, "and he can't hear you." She looked at Ethan. His eyes had come to her the moment the door opened, with the speed and intensity of someone who has been in a room alone with a thing they didn't understand and has just been given an exit. She crossed the room and crouched beside his chair and signed, "Are you okay?" He signed back quickly. He came in and started talking. "I don't know what he said. I know. I'm here now." She stood and turned to face Holloway. She positioned herself between him and Ethan without making a performance of it, the way she had positioned herself between Ethan and Branson 3 days ago in the corridor, the same geometry, a different room. "Whatever you came here to say," she said, "you can say it to me." Holloway's jaw tightened almost imperceptibly. "This is a family services follow-up, standard protocol, when a patient's family member is a minor on the premises without a legal guardian. His father is in the SICU and his mother is deployed. He's been with an assigned social worker." She kept her voice flat. "Who authorized this visit?" "I don't require individual authorization for a family services. Who authorized it?" The question sat between them. The answer was nobody, and they both knew it. And the particular thing about Holloway in this moment was not that he had done something overtly wrong. It was that he had done something that was in the exact borderline space he had always operated in, individually defensible, cumulatively pointing somewhere. But the IG review was going back 6 years now, and Reyes was 2 floors up, and Ethan was watching her hands. "I think you should leave this room," Megan said. "Now." Something crossed Holloway's face that she had not seen there before. Not anger, not composure, but something underneath both. A brief, unguarded look of a man who has spent a long time being the person who determined outcomes, and who is standing in a room where that is no longer true. It lasted less than 2 seconds. Then he straightened, nodded once with the precision of someone performing dignity, and walked past her to the door. He stopped in the doorway. "The review against you hasn't been formally withdrawn," he said. "Whatever conversations have happened upstairs this morning, the administrative process, has been noted by the Inspector General's office," she said. "I talked to your legal counsel before you file anything else." He left. She listened to his footsteps go down the corridor, measured, deliberate, the same walk as always, and she thought about how long it took a pattern to become visible, and how much it required someone to be paying attention before it did. She had been paying attention for 1 day. Okoro's office was going to pay attention for 6 years' worth of days, and what they found was going to determine what happened next. She turned back to Ethan. He was watching her with the focused, slightly complicated expression he got when he had been trying to read a situation from visual cues and had decided he needed more information. What did he want? He signed. She thought about how to answer that. She thought about what was true and what was the right amount of true for an 8-year-old in a hospital waiting room whose father was upstairs with a temporary pacemaker. "He made a mistake," she signed. "Adults do that sometimes. People are fixing it." Ethan looked at her steadily. He had his father's quality of receiving information, taking it in without performing a reaction, processing it somewhere internal, arriving at his own conclusions. "Is he going to do it again?" He signed. "No," she signed. And she meant it, in the specific way of meaning something not because the outcome was guaranteed, but because the machinery that produced it had been interrupted at the source. Ethan accepted this. Then he signed, "Can I go see my dad today?" "Yes," she signed. "Let's go." Marcus was moved out of the SICU at 2:17 that afternoon. The cardiology team had evaluated the pacemaker lead placement that morning and determined that his cardiac conduction issue was likely vagal in origin, connected to the surgery, and had a high probability of resolving on its own within weeks. The temporary pacemaker would stay for observation. He was moved to a step-down room on the 2nd floor with a view of the bay. Not a spectacular view filtered through a row of maintenance buildings and a chain-link fence, but water was water, and the light on it in the afternoon was a particular silver that made the utilitarian setting beside the point. When Megan brought Ethan in, Marcus was sitting up in the bed looking more like himself than he had at any point since she'd first seen him, less flattened, less at the mercy of what his body was doing, more present. The pacemaker lead at his collar and the IV in his arm were the visible markers of what he'd been through, and he had the careful stillness of someone whose body had recently reminded him that it had opinions, but his eyes were clear. Ethan stopped in the doorway. He looked at his father, and his father looked at him, And whatever passed between them in that moment didn't require language of any kind, signed or spoken or otherwise. It was just two people who had been separated by circumstance and machinery and 3 days of not knowing, and the specific relief of that gap closing. Ethan crossed the room in 3 steps and sat on the edge of the bed, and Marcus put his arm around him, carefully, because of the lead, and they stayed like that for a while. Megan stood in the doorway and looked at the bay. She had a shift starting at 3. She had documentation to complete on Alan Trask, who had been transferred to the ICU and was stable. She had a conversation scheduled with the JAG office for later in the week about the record reconciliation, and she had a message from Garrison on her phone that she had listened to that morning in her car in the parking structure before she came in, sitting with the engine running and the bay visible through the windshield. Garrison's message was 43 seconds long. He had the voice of someone who was used to keeping things brief, because the situations he operated in did not reward lengthy communication, and he had applied that economy to something that was not a tactical situation and was clearly requiring him some effort. He said, "The notification came through." He said, "I've been trying to find out for 11 years what happened after that door closed." He said, "I know this is a lot, and I'm not asking for anything except," and then a pause, "just to know you're okay, just that." She had listened to it twice. Then she had gotten out of the car and gone into the building. She was going to call him back. That was decided. The question of what she was going to say was less decided, but she had found, over the years, that the right words for things generally presented themselves when you arrived at the moment, and not before, and that preparing too carefully for an emotional conversation was a way of armoring against it rather than having it. Marcus signed something to Ethan, and Ethan signed back, and then Marcus looked up at her. "Reyes told me about the meeting this morning," he said. "It was productive," she said. That's one word. He looked at her with the directness that was his default. "Holloway is in the process of having a very long conversation with the IG's office," she said. "That conversation is going to take a while." Marcus was quiet for a moment. "The interpreter program. Being resourced within 30 days, Reyes was specific." "Good." He looked at Ethan, who was watching both of them, tracking the conversation in the way he tracked all conversations. Not with frustration, but with the patient, practiced attention of someone who had become very good at reading the full picture. Marcus signed to him, something brief, and Ethan's expression shifted. He looked at Megan. "He says you made them listen," Ethan signed. She looked at Marcus. "Your dad is charitable. He says you knew things no one else knew, and you didn't stop even when they tried to make you stop." She thought about how to answer that. She thought about all the things that had happened between the moment she'd crouched beside Ethan in the corridor 3 days ago, and this room, this afternoon, the light on the bay outside the window. She thought about the particular weight of moving forward when the people around you have decided the direction you're moving in doesn't belong to you. "Your dad knew things too," she signed. "He knew his own body. He knew something was wrong. He told the right person." Ethan considered this. Then he signed, "Can you teach me something?" "What?" He thought about it for a moment, the specific thinking face of a child who has arrived at a question from somewhere genuine. Then he signed, slowly, a word she recognized, hero. She looked at him. She looked at her hands. She had been called things in her life: specialist, chief warrant officer, medic, Miss Hart. The nurse nobody took seriously. She had answered to all of them, had worn them with varying degrees of comfort, had let some of them define her and released others as the circumstances required. She was 36 years old, and she had saved 19 lives in a room with 8 minutes on a device, and she had lost part of her hearing and gone home and gotten a different job and done that job for 3 years, with nobody knowing what she'd done before it. She had not done any of it for recognition. Recognition was not the point. But she knew, in the way you know things that cost something to learn, that there was a difference between not needing recognition and not deserving it, between choosing not to ask for something and having it taken, between humility and erasure. Those were not the same thing. She had spent 11 years in the space between them, and the space had been larger than it should have been, and that was being corrected now, not because she had demanded it, but because the record, when you looked at it honestly, demanded it on its own. She showed Ethan the sign. Hero. Dominant hand flat, touching the chest, moved forward and upward in a specific arc. She demonstrated it slowly, twice, watching his face as he tracked the motion. He copied it. Not perfectly. His arc was slightly off, the hand position a degree or two from the standard, but close, and with the specific earnestness of someone doing something they mean. Then he signed it toward her. She shook her head, signed back, "Nurse." He shook his head, with the decisiveness she had come to recognize as one of his signature qualities, the refusal of an 8-year-old who has decided he knows something. "Hero." She looked at him for a moment. She thought about what it meant for a child to draw a line between those two words and choose not to see it, not out of ignorance, but out of a kind of clear-eyed generosity that children sometimes had before the world taught them. The categories were supposed to be separate. She let it stand. The formal review notice against Megan Hart was withdrawn on a Thursday, 11 days after the meeting in Yarbrough's conference room. Yarbrough signed the withdrawal herself, and included a notation in the record that the actions documented in the review had been determined to represent sound clinical judgment in service of patient safety, and that the initiation of the review had not taken adequate account of the clinical context in which the documented actions occurred. It was a careful sentence, bureaucratic in structure, deliberate in its precision, and it said, in the way institutional documents said things, that the record needed to be right. The commendation for Virginia Beach was entered into Megan's official military record on the same Thursday. It noted the date, the operation designation, the specific action, entry into a secondary device room following team lead incapacitation, successful neutralization of the device within the active countdown window, resulting in the preservation of 19 service members. It noted her rank at the time. It noted her injury. It was 2 paragraphs, and it was accurate, and it existed now in a file that had previously said she was dead, and the correction of a record is not a dramatic thing in the moment it happens. It is a form and a signature and a file update, but the absence of that correction had been a weight she had not fully measured until it was gone. Garrison called the same evening. She took the call in her car, parked at the edge of the Harwick lot with the bay visible, the way she'd taken the first Reyes call, because she had apparently developed a habit of having significant conversations in her car near water without quite deciding to. He sounded different from his voice message, less careful, more unguarded, the way people sound when the prepared version of a thing has already been delivered and what's left is the actual thing. "I don't know what I expected," he said. "When I found out you were alive, I've thought about what I would say for 11 years, and I had nothing." "You had 43 seconds, she said. A pause. Then something that was almost a laugh. "That's more than I usually manage." He paused. "I'm glad you're okay. That's the whole thing, really. I'm glad." "Me too," she said. And she meant it in a specific, uncomplicated way she had not expected to mean it. They talked for 22 minutes, which was about 20 minutes longer than either of them had planned. She found out that he had a daughter who was 10, that he had retired to coastal Virginia, that he had started an EOD training consultancy that was smaller than he'd intended and more satisfying than he'd expected. He found out that she was a nurse, that she had built something in the years between, that she was still in the room even when the room was a hospital corridor, and the device was an administrative process, and the timer was someone's blood pressure dropping. "Same work," he said, "different tools." "More or less," she said. When she got off the phone, she sat in the car for a moment in the particular quiet of a thing that had been undone. Not fixed. She was not naive enough to call it fixed. Garrison was a person she had thought about and not called for 3 years, and calling him was not the same as the 11 years before that, and the scar tissue of all of that was still present and would be. But the call had happened, the record had been corrected, the fragment was out of Marcus Cole's skull, and the tremor was gone, and Ethan had an interpreter now. A full-time ASL interpreter named Rosario, who had started the previous week and who had, according to Ethan in a signed message via Marcus's phone, already beaten him twice at a card game he was sure he'd invented. She started the car and went back to her shift. Grant Holloway was formally removed from his position as Administrative Director of Harwick Naval Medical Center on a Friday, 6 weeks after the IG review began. The review had gone back 5.5 years. What it found was not a single catastrophic decision, but the pattern Reyes had described. Resource flows that were individually defensible and collectively pointed somewhere specific, toward an administrative layer that had grown at the expense of service-facing programs, including the interpreter program, including the family liaison office, including 2 others she hadn't known about. None of it was dramatic in the way that scandals wanted to be dramatic. There was no fraud charge, no criminal referral, no single moment of obvious wrongdoing. What there was, documented across 70 pages of IG findings, was a sustained and deliberate prioritization of administrative overhead over patient services in a military medical facility at the expense of the people the facility existed to serve. The findings were given to the CO. Yarbrough referred them to the commanding authority above Harwick. The decision to remove Holloway was made at that level, which meant it was not a personnel dispute and not a nursing complaint and not a flag officer exercising informal pressure. It was an institutional finding, documented, reviewed, and acted on through the proper channel. Holloway was given the option to resign, which he took. She found out from Patrice, who told her in the break room on a Friday morning with the specific directness of someone who has been holding information for the appropriate amount of time and has now delivered it. Megan poured her coffee. She thought about what she felt, and the honest answer was that it was not satisfaction exactly. It was something quieter and less clean than satisfaction. She thought about the families before Ethan, the ones in the gap months, the ones who had come to Harwick with communication needs and had not been met, the ones who had left without having understood their loved one's prognosis or treatment or options. She would not know their names. The IG review would generate some accounting of the impact, but the specific people were invisible in the way that the people most failed by institutional gaps were always invisible, numerous and unnamed and not in the room when the findings were delivered. The removal of Holloway corrected nothing for them. It was the right thing to do, and it corrected nothing, and both of those things were true simultaneously, and she was old enough and had seen enough to hold both without needing to resolve them into one. The interpreter program is funded, Patrice said. Rosario's been approved for full-time. They're also interviewing for a second. Good, Megan said. And Yarbrough asked me to tell you. Patrice paused in the specific way she paused when she was delivering something she had been asked to deliver and found personally awkward. She wants to know if you'd be willing to serve on the hospital's Patient Communication Standards Committee. She's reconstituting it. She wants a clinical voice on it that knows what it's talking about. Megan looked at her coffee. She thought about committees. She thought about standards and the gap between standards that existed on paper and standards that existed in practice. She thought about all the things she knew, the clinical things, the tactical things, the hard-won things that had no official credential attached, and about the particular waste of knowledge that was never applied because the person who held it had been told to stay in their lane. Yes, she said. Patrice looked mildly relieved. Good. She's going to be glad. She stood up. One more thing, from Reyes. He asked me to give you this personally. She put a folded envelope on the counter and left. Megan looked at the envelope. She opened it. Inside was a card, plain, military utilitarian, and a single printed page, which was a copy of the commendation from her record. Below Reyes's signature was a handwritten line, for the record, and for the 19. She folded it and put it in her pocket. She finished her coffee and went to her floor. 3 months after the day. Ethan Cole had screamed in a hospital corridor, and a nurse had crouched beside him and signed 3 words that made it stop. Megan stood in a conference room at Harwick Naval Medical Center and presented a training framework to a room of 14 people. The framework covered emergency communication protocols for patients with hearing loss or speech impairment, ASL foundations for clinical staff, and a rapid response interpreter access system for after-hours situations when a certified interpreter was not on site. She had built it over 8 weeks, drawing on her own training, on Rosario's expertise, on the input of 2 deaf veterans who had agreed to consult, and on everything she had learned from years of working in environments where communication in a crisis was not a courtesy but a survival tool. The room included 4 nurses, 2 attending physicians, 3 administrative staff, a JAG liaison who was there to review the compliance components, and Yarbrough, who sat at the end of the table with the attentiveness of someone who has decided a thing is worth their time and means to demonstrate it. Reyes had sent a representative, a junior officer named Park, who took notes with the efficiency of someone who understood that the notes mattered. Mercer was there. Mercer had asked to be there. She had not explained why, and Megan had not asked, and they had not had the explicit conversation about the day in the corridor where Mercer had told her to stay in her lane, because some things were better addressed by what you did next than by the conversation you had about what you'd done. What Mercer did next was show up, sit in the front row, and ask 3 substantive questions during the presentation that demonstrated she had read the framework document in advance. That was enough. She presented for 40 minutes. She was not a performer. She did not have the instinctive ease of people who enjoy being in front of rooms. And she was aware, throughout, of the specific awkwardness of being a person who had operated in silence and invisibility for a long time, and was now standing in a conference room asking people to listen to her. She moved through it the way she moved through most things, directly, without apology, starting from what she knew was true and building outward. When she finished, Yarbrough asked 2 questions about implementation timeline. The JAG liaison asked about the compliance documentation. One of the nurses asked about the ASL curriculum and whether the sessions would be recorded for staff who couldn't attend in person. Then one of the physicians raised his hand, a hospitalist she knew slightly, a man named Bertram, who had a reputation for asking the question nobody wanted to ask, and said, "Can I ask what the foundation for this is? What gave you the expertise to build this framework?" The room got slightly quiet in the way rooms got slightly quiet when they recognized a question that had more than one answer. She looked at him. She thought about what she was going to say and said the simplest version of the true thing. "I spent 4 years as a Navy EOD medical specialist working with a team that included a deaf combat medic. Communication in those conditions was not optional. You either learned or people got hurt." She paused. "I learned." Bertram nodded slowly. "So this comes from combat experience. It comes from working with people who needed to be understood in situations where not understanding them had real consequences." She looked around the room. "That's also this building. It's this building every day." Nobody argued with that. After the meeting, she was in the corridor gathering the printed materials when Mercer came out and stopped beside her. "The curriculum," Mercer said. "The ASL component. I'd like to do the full version, not the abbreviated clinical one." Megan looked at her. "It's 8 sessions." "I know. I read the framework." She absorbed this. "I'll send you the enrollment link." Mercer nodded. She started to leave, then stopped. "Miss Hart." She turned. Her face was doing the complicated thing of a person who has arrived at something difficult through a route that required admitting something, and who has decided to arrive at it anyway. "You were right. About the sedative, about the fragment." She paused. "I should have looked at the scan when you asked me to." "You looked at it when it mattered," Megan said. "I looked at it 4 hours later than I should have." Megan picked up her materials. "Then do it differently next time." It was not forgiveness exactly. She was not performing forgiveness, was not interested in the theater of it, but it was something more useful, which was the acknowledgement that the story didn't have to end at the place where it had gone wrong. The story could keep going. The decisions could be different. That was the whole point of being in a building full of people whose job was to not let things stay broken. Mercer left. Megan walked to the elevator. She called her brother on a Tuesday evening, standing in her kitchen with the window open and the sound of the neighborhood coming in through the screen. His name was Daniel. They had not spoken in 4 years for reasons that were specific and complicated and had to do with Virginia Beach, and the years before Virginia Beach, and a version of grief that her family had processed without her because they had been told she was gone. The reconciliation of that, the paperwork of it, the official version of what had happened, had been corrected through Reyes and JAG and a process that had taken weeks. The human version of it was a different process and had no office and no form. She had been putting it off. She put it off for the reasons people put things off, not because they don't know they need to happen, but because knowing something needs to happen and having the capacity to make it happen are not the same thing, and sometimes the capacity has to accumulate before you can use it. She had spent the 3 months since Ethan's hands in the corridor doing a lot of things that were about moving forward, and she had needed to move forward for a while before she was ready to go back. He answered on the 3rd ring. "Hey," he said. Just that. Not Megan, though she heard the recognition of it in the syllable, the adjustment of a person whose voice had changed to receive something they had been not quite waiting for. Just, "Hey," which was the family word for "I'm here, I've been here, I didn't go anywhere." "Hey," she said. The conversation lasted an hour and 40 minutes, which was not because they resolved everything. They didn't, and both of them knew they wouldn't in one call. And the honesty of that acknowledgement was itself a kind of foundation. But because they had a lot of ground to cover and they were starting from the beginning, which was where you had to start when the middle had been missing for 4 years. He told her their mother had moved to Charlottesville. He told her he had gotten married 2 years ago. She told him she was still at Harwick. She told him about Marcus Cole and Ethan and the committee and the training framework in the abbreviated version, the version that communicated the shape of it without every detail, because the full detail would take more than one call. "You never really left, did you?" he said. "The work." "No," she said, "even when you were doing something else." "Even then." He was quiet for a moment. "Mom wants to see you." "I know." "When you're ready." "I know." She looked at the kitchen, the ordinary kitchen of a person who had a life in it, the small accumulation of that life in the particular details, a coffee mug with a handle she'd glued back twice, a plant on the windowsill that had survived 3 years on benign neglect. "I'm getting closer to ready." "Good," he said, and the word had the same quality as hey, uncomplicated, solid, the word of a person who is simply glad the thing is happening and does not need to attach anything else to it. On a morning in the following spring, Ethan Cole visited Harwick for the first time since his father's recovery. He came with Marcus, who was on a follow-up appointment for the pacemaker assessment, a brief routine visit, the kind that existed to confirm that everything was functioning the way it was supposed to and could now be documented as stable. The pacemaker had been removed 8 weeks after placement, the cardiac conduction issue having resolved as predicted, and Marcus had returned to limited duty in January and was on track for full reinstatement. He moved through the hospital with the specific ease of someone who had been through something in a place and had come back to it and found it changed enough to accommodate the visit. Ethan had grown. That was the first thing she noticed, not dramatically, the way children grew in movies, but the ordinary increment of 3 months, slightly taller, slightly less angular in the face, the gray hoodie replaced by a navy one with no writing on it. He saw her at the nurse's station on 4, where she happened to be standing, and his face did the thing it had done the first time she'd signed to him in the corridor, the complete, unguarded opening of recognition, and he signed before he was fully across the room. "Hi." "Hi," she signed back. He came up to the station and looked at the unit around him with the particular attention he brought to environments he was reading, and she watched him do it. The quick inventory, the parsing of who was where and what they were doing, the natural visual acuity of someone who had always gotten information through his eyes because the other channel wasn't available. "I want to show you something," he signed. He pulled out a small notebook from his jacket pocket, a regular composition notebook, the kind that cost $2 at any pharmacy, and opened it to a page in the middle. The page was covered in hand-drawn diagrams, small and slightly imprecise in the way of an 8-year-old's drawings, but recognizable. He had drawn 2 hands in the ASL position she had shown him. Beside each one was a printed label in a child's block capitals. He had been cataloging hand shapes. Not the alphabet, he already knew the alphabet, but the specific signs she had shown him over the visits: safe, hero, nurse, important, stay. She looked at the notebook for a long moment. "You've been practicing," she signed. "Rosario helps," he signed, "and I looked things up. I want to learn more." "You will," she signed. He flipped to a later page. On this one, at the bottom, under a small drawing of 2 hands, he had written a question in block letters and left space below it, as if expecting an answer to be filled in. The question said, "What is the sign for safe?" She looked at him. He had been in the hospital when she'd signed it to him. He had been terrified and alone, and she had signed exactly that word to him in the corridor, and it had been the thing that made the screaming stop. She realized he didn't want her to tell him. He wanted her to show him, again, in this room, not because he'd forgotten, but because he was building a record, and he wanted it in the notebook with a note that said, "She showed me." That was what the blank space was for. She showed him. He drew it carefully, in the notebook. Then he looked up. "You're going to teach people here," he signed. It was not a question. "I am," she signed. "Staff, nurses and doctors, how to communicate with patients who can't hear. Because of me?" She looked at him. She thought about Ethan, and about all the children before Ethan, who had sat in waiting rooms in hospitals without interpreters, without anyone to tell them what was happening to the person they loved, without anyone whose hands moved in the language they understood. She thought about the program and the committee and the framework and the 2-hour compliance window that now had teeth, and about the specific chain of events that had started with a child screaming in a corridor because he had run out of other ways to say, "I need someone to see me." "Because of you," she signed, "and because of a lot of others." He absorbed this with the seriousness he brought to things that deserved seriousness. Then he signed, "Good." Marcus appeared at the end of the corridor, coming from the elevator, and Ethan turned and waved and turned back. "One more thing," he signed. "What?" He thought about how to sign it. She could see him working it out, the deliberateness of a person choosing language carefully. And then he signed, with the arc slightly corrected from 3 months ago. "I'm going to be a doctor, for people who can't hear, so they always have someone." She looked at him for a moment. She thought about the specific arithmetic of a life's work, the thing you chose, or the thing that chose you, or the thing that emerged from the intersection of what you were capable of and what the world in front of you needed. She thought about a deaf combat medic named Warren, who had taught her sign language in a field environment with the patient exasperation of someone who had decided to go get the people instead of waiting to be met. She thought about 19 men and a door and 8 minutes, and the thing that had come after, the years, the hospital, the corridor, the boy. She thought about what it cost to stay in a room when everything in the room was telling you to leave. Not dramatically, not with a weapon, not with a timer, but the way it cost every day in small rooms with small decisions that accumulated into something, eventually, that either mattered or didn't, and you never entirely knew which until you were already in the middle of it. She thought about what it meant to be someone that a child looked at and decided to become. "You will," she signed. Simple, direct, no performance around it, the way she said the things she meant. Ethan smiled. It was a real smile, the kind that arrived from somewhere genuine, and he tucked the notebook back into his pocket and went down the corridor toward his father. She watched him go. The unit moved around her, the monitors, the soft footfall of the nursing staff, the ordinary, continuous life of a place that existed to hold people in the worst moments of their lives and return them, when it could, to their ordinary ones. She had been part of that for 3 years. She was going to be part of it differently going forward. The committee, the training, the framework that was now in 14 staff members' hands, and counting. And the difference was not about recognition, though the recognition had been deserved and had mattered more than she'd expected. The difference was about what a person did with the things they knew when the room they were in needed those things, and the person in charge of the room told them to stay back. You could stay back. That was always an option. It was the easier option, most of the time, and the consequences of not staying back were real and sometimes severe, and she had lived those consequences and continued to live them. But staying back had its own cost, quieter, slower, the kind of cost that accumulated in the dark without a timer counting down. In the specific toll of what went wrong in the rooms you could have changed and didn't. She had decided, a long time ago, which cost she was willing to pay. She turned back to the station. She had 4 patients and a training session at 2 and a committee meeting on Thursday and a call to return from the IG's office about the compliance documentation, and the day was not going to pause to accommodate anything other than the next task. She had learned to find her footing in exactly that, the continuous, unglamorous, often thankless forward motion of work that mattered even when nobody was